Okay. Good morning, ladies and gentlemen. Minister, you're very welcome this morning to the Cultivating Mental Wellbeing in Rural Ireland conference, which is hosted by the Department of Agriculture with the support of the Department of Health and the Health Service Executive. Also want you to encourage you to get involved in there will be an opportunity during the discussions to make points and to ask questions of the panelists. So I'd encourage you to get involved. And for those of you online, there is a question box on the corner of your screen into which you can put your questions or comments, which will be read out by my colleague. And now I would like to invite the Minister to open proceedings now at this stage. Thank you very much, Minister.
Good morning, ladies and gentlemen, and thank you to everyone who's, first of all, helped organise today, which I think is a really important event and a great opportunity for us to be here, and for you for making the time out of your busy schedules to be here to share your insights and views with us here today. It's really good for me to be here to open Cultivating Mental Wellbeing in Rural Ireland conference, which has been hosted by my department, Department of Agriculture, Food and Marine, with the support of the Department of Health and the Health Service Executive. And I do want to acknowledge the partnership with the Department of Health and the HSE. I think it's how government should work and how state agencies should work in collaboration, in partnership, pulling on all the synergies that we have for the best possible outcome. This conference, as we know, coincides with International Men's Day, which took place yesterday. The theme of International Men's Day 2023 is Zero Male Suicide. It brings home the importance of our mental well-being and the mental well-being of our loved ones. Today represents an opportunity for our panelists to share their insights and expertise with our audience in the room and those online, so that we can all help cultivate mental well-being no matter where we are. Mental health is much like physical health in some important respects. At times you need to work out to get strong. At times you break. And as Ernest Hemingway said, many are strong at the broken places. But you shouldn't have to break to get better. And as the old adage goes, prevention is most definitely better than cure. And in that respect, mental health is very unlike physical health, because you can't get a plaster for the mind. We can estimate how long it'll take to heal a broken bone or recover from surgery, but estimating recovery from mental health is a lot more challenging. So I would encourage people today and over the rest of the week to take stock and to check in with yourself and do likewise with your friends or loved ones. A kind word or an expression of concern doesn't cost a thing and shouldn't cost anyone an afterthought, either in its giving or in its receipt. If you're struggling with an issue, realize that things get much easier after taking that initial difficult first step of asking for help. But taking that initial step and asking for help is critical and often not easy. But help is there, and I would encourage everyone to reach out to the services here today and those outlined in our literature, which will also be available to people joining remotely. Mental well-being is, of course, an area of importance across society, but in rural and coastal communities, among our farmers, our fishers, our foresters, there is a unique set of challenges. Those male-dominated industries have a poor safety record, particularly farming, which accounted for approximately 4 in every 10 fatal workplace incidents in the last 10 years. Despite only 7% of the working population being employed in the sector. To date, there have been 11 confirmed farm fatalities in 2023, unfortunately, plus 1 fatality in forestry and 1 in the fishery sector. Despite improvements in recent years, these numbers remain far too high. Behind each one of these statistics is a devastated family, business, community. Every death is one too many. In addition, there are approximately 4,500 non-fatal incidents each year on Irish farms, some of which result in life-changing injuries. These fatal and non-fatal incidents have a devastating impact on farms around the country. Mental well-being can be a factor. A busy and distracted mind is rarely focused on the task at hand. That is when things can go wrong and a routine job can shatter lives. Given that farming is a male-dominated industry, the influence of men as role models is critical when it comes to changing behaviour and making risk practices unacceptable, because ultimately this all comes down to our attitude to risk. Identifying it beforehand, trying to mitigate it, it's a key part of it. On average, 95% of fatal incidents each year on Irish farms over the last 10 years involve men. And even allowing for a low percentage of female farm owners, this is still above average percentage. And while we are marking International Men's Day, I want to take also reference and acknowledge the critical role that women play in agriculture as role models themselves. So often it is women on the farms who are the advocates for safer farm practices and who call out unsafe behaviours. The buzzword at the moment is sustainability. A young farmer at an event I recently attended described sustainability as a three-legged stool: environmental, economic and social. And if all three aren't in balance, the stool falls over. To have a sustainable agricultural sector, it is important that everybody working and living on farms are kept safe. Farm safety is not just about preventing injuries, but also about farmers taking care of their health and well-being. That is at the core of the social sustainability that we just talked about. We need to remove any stigma seeking help for mental health. Thankfully, I believe things have changed and are changing. Each of us can act as role models by talking about mental health in the same way that we talk about cancer or broken leg. We must actively support people. A simple "how are things" might trigger a conversation that makes all of the difference. Farming is an incredibly rewarding profession. We all know farmers in our lives who take huge pride in the work they do, but it is also a job with an array of potential stressors, often outside of the farmer's control. Weather can be unpredictable. This year of all years highlights that. Input costs, commodity prices, there is a huge variability. Our rural communities are also not immune from the blight of drug abuse. Drug abuse and heavy alcohol use can lead to poor mental health and physical health, and put stress, obviously, on families and on communities. Recently published research by DCU found that 5% of the farmers surveyed reported using substances and 4% used substances to a harmful extent. The study found that while 28% of farmers did not drink, 40% of those who did so excessively. In order to better understand how social sustainability of agriculture is changing, we need to collect information on these issues. More and more information on topics including farmer well-being, farmer succession, farm safety, community engagement and access to services are being collected through the Teagasc National Farm Survey. The most recent set of results show 40% of farmers across all farm types say their farm business has been a strong source of stress in recent years. Weather challenges, excessive workload and financial concerns were all highlighted. More positively, 78% of farmers surveyed felt they had good or very good health. Many people who experience poor mental health at some stage during their lives. It is important that anyone struggling with stress or health issues seeks the appropriate care and supports and feels reassured that the supports are there when needed. Since my appointment as a Minister of State, I have prioritised efforts to improve the record on farm safety, health and well-being. This year, dedicated funding of €2.5 million was allocated for a range of initiatives, including support to promote increased awareness of the importance of health and well-being among farmers. I am pleased to have secured €2.5 million again in Budget 2024 to continue and expand the range of initiatives. These initiatives aim to promote challenges in cultural norms around farm safety, health and well-being, including barriers to discussing and seeking help on mental health. The agricultural community is the origin of the spirit of MEHL that guides our approach. My department is collaborating with other government departments, state agencies, support organisations and farmers in efforts to improve farm safety, health and well-being. With support of the HSE and the Department of Health, we are co-funding a farmers' physical and mental health awareness programme called On Firm Ground. The training delivered under the first On Firm Ground programme provided advisors with the skills to engage with and signpost supports to farmers. And it really was successful because we all know the really valued, trusted role an advisor has in a farmer's life. And those conversations leaning over the gate at the end of a farm visit was a great opportunity. But actually what brought it about first was advisors saying to us they were seeing farmers under stress, displaying signs of distress. And the advisor left very concerned that maybe they hadn't the skill set to appropriately signpost the supports that are available. And they felt very concerned that maybe they wanted to be equipped and better equipped. So it came from a very good place on firm ground. And I'm delighted to be able to co-fund the expansion of this training programme now to others who work with farmers, including vets, staff in my department, while also continuing to train farm advisors. We ultimately want to get to a place that anybody who has an element of contact with farmers, who identifies stress or hazards, has the opportunity to signpost the supports that are there. Because in our experience, when somebody reaches out for help, that is the biggest challenge. Once they do, the systems and the supports are there around the country to help people, but it's that farmer, that individual identifying that they're under stress is the biggest thing. And maybe someone coming in from the outside can see it quicker than the person themselves can. All too often, that'll be the case. So I'll continue to explore opportunities to provide the training to other groups who work with farmers. We should never miss an opportunity to spot a farmer in distress. There is huge power in a casual chat leaning over that gate with someone who's trusted by the farmer. The comprehensive one-day training provided under on Farm Ground 2 programme focuses on best practices in engaging farmers with health programmes and signposting them to supports in relation to health and well-being. It is essential that those working with farmers know how to act if they encounter a farmer under pressure. What might seem like a small act of support at a critical time for a farmer can have an immeasurable impact on how a farmer can overcome a stressful situation. My department is also funding Farm Health with a capital M, a study in Irish farmers' mental health literacy and help-seeking behaviour. The study has also examined the prevalence of mental health issues such as anxiety, depression, alcohol misuse and associated factors in Irish farming. A bespoke evidence-based mental health programme will be designed from this programme to improve Irish farmers' knowledge of mental health issues and help seeking. Farm Safety Partnership is an advisory committee to the Health and Safety Authority, has also been active in this area. It recently published a booklet on farmers' health and well-being, a guide to staying healthy while farming. The booklet includes a section on coping with stress and minding your mental health, and the booklet was included in the 2023 BIS packs, which was issued to over 122,000 farmers around the country. I look forward to pull every lever we can to support farmers and cultivate mental well-being, whether that's addressing stressors on farms, identifying early people who may be struggling, or supporting those who find themselves in a difficult place. For too long, farmers have experienced a disproportionate burden of health problems related to mental health, less likely than the general public to seek help for mental health difficulties as well. I believe events like this conference and initiatives such as On Farm Ground will help remove the reluctance to discuss mental health and well-being and the barriers to seeking help. I wish to thank you for attending this important conference this morning. Whether you're a farmer, a health professional, or involved in research, no matter who you are, we can all, working together, help to make a difference. I look forward to chairing this first panel with the great panel we have here. But before I do, let me introduce the Health and Safety Authority's Mental Health and Wellbeing in Farming video featuring Finola Colgan, Mental Health Ireland, and George Graham, sheep shearer and farmer. In this powerful video, George, who is here this morning, describes how depression impacted on his life and how he dealt with the issue. Thank you.
I didn't understand what was wrong with me. I did what a lot of people try to do. I tried to run away from my problem. I'm a third generation shearing and I have a son who's also a shearer. Sheep shearing has brought me out around the world, 13 different countries. I suppose I've been very fortunate. I've had the opportunity of representing Ireland 11 times in World Championships. There's a lot of pressure put on farmers that wasn't there years ago. To be a good farmer now, you need to be able to deal with the weather. You probably need to be a lawyer. You need to be a mechanic. You need to be an electrician. You need to be a good stock person. You have to be a little bit of all those to be a farmer. So it's big changes to what it has been years ago. I've been one of those people that found myself in a very dark place, in a bad place for quite a long time. I was working in one of those countries, which was the north of Norway. Every night I would go to bed quite early. I wasn't eating properly. I wasn't sleeping properly. And the only thing in my head 24/7 that I just wanted to end my own life. My mind was on overtime, just racing here, there, everywhere, just gone, just an absolute nightmare, thinking of all these crazy things. But I couldn't stop it. I couldn't control it. But I actually done in Norway, I took what I describe as the first step. And the first step for anybody is the hardest step you will ever take. This couple I was working for, the farmer and his wife, she was a psychiatric nurse, and I got a new job at Heydon 3 or 4 miles down the road. And I happened to say to her this day, I don't think you have a lot of English, could you help me with some translation? And she said, no problem, just ring or call anytime you want. But if I was being honest with her, which I wasn't, and being honest with myself, that's not what I wanted to say to her. I wanted to say, I'm in the depths of despair, could you help me? But her answer was, yes, no problem, just ring or call anytime you want. That was a lifeline for me. Went home, went to my family GPs. I was very quickly diagnosed. I was suffering with depression and I was given some medication. It's probably the worst place you ever could be. Probably one of the better ways of describing it. It's like going through a long, dark, twisty, narrow tunnel. And it can be very steep in places and very, very narrow. It's difficult to get through that tunnel on your own. But if you can keep going, you will get through that tunnel. And the closer you get to the end, there is a light there and that light will get brighter and brighter.
We are living in stressful times, but it's very important to also understand that farming brings its own unique stresses, basically because of the nature of farming and the demands made of it and the lifestyle that goes with it. So it's really important that farmers make time for themselves to get off the farm, meet a friend for a cup of coffee, a chat, a tea, join a card game, make that connection with other people. But it can also be a cycle, it could be, you know, a jog, it could be a swim. But what's really important is making that time for yourself.
The one thing about this mental well-being problem, you cannot carry or continue to carry this load on your own. You need to share it. And I accept it can be quite difficult to share with your family or maybe even going to a GP. But call a friend and say you'd like to have a chat or could I meet him for a cup of tea. That's the first step.
We're all human and none of us are an exception to stress, anxiety. But what's really, really important is to go and seek that help. And it can be go to the doctor. You know, there's an awful lot of excellent helplines out there. Just pick up the phone in the quietness of your own place, your own mobile phone inside the tractor, and just make that call and say hello to the organisation and say, I'm struggling. And that's the start of the conversation.
There is help out there, there is support out there. And if nothing else comes from this, I will just coax people, take that first step, talk to somebody. There is a light at the end of that long dark tunnel and it will work for you as well.
Very good. And while I was at the launch of that video before, I again would like to acknowledge George and the HSA for putting together what is a really important, thought-provoking piece of footage there in that. So let me introduce our panel. Delighted to be joined here by such an array of different perspectives and expertise. Beside me here is Dr. Noel Richardson. Noel has an extensive experience in the areas of men's health at research, policy and advocacy level. He is the principal author of Ireland's Department of Health's National Men's Policy, Health Policy back in 2009. And I'll let Noel talk a little bit more about himself in a minute. But beside Noel, we have Donla Heydon, who is an assistant professor in the School of Health and Human Performance at Dublin City University and is a co-investigator on the Farm Health Research Project. Next, then we have Dr. David Meredith, who works at Teagasc's Department of Agri-Food Business Spatial Analysis, where he leads applied research focused on understanding the safety and health of farmers, farm workers and farm families with the objective of informing both policy and practice. And then last but by no means least is Pete Hines, a Cork dairy farmer, farming pedigree Holstein and Jersey cows along with his wife Paula and family, who is well assisted at home as well on that one. So maybe as an introduction, I might ask an opening question to each, and you can tell us a little bit about yourselves and your background. But I might start, Peter, with you in terms of, we've heard George's personal perspective there about mental health and reaching out for support and identifying being under pressure. Maybe as a farmer, and I've been down in your yard in Cork, you know, with all of the stresses and strains that go with working on a busy farm, but also all the isolation that goes down. Maybe enlighten us with your own perspective around the challenges that there are there for farmers in that space.
I think, look, I think the most important thing to understand with mental health and with agriculture is that, you know, we're not a unique country. Every country around the world farmers face the same challenges, which ultimately, you know, at times impact their mental health. And you know, I'm someone that has struggled with my own mental health in the past, so I'm very conscious of how I try to manage myself and manage within those pressures. And it often puts me in a position where I guess I need to step back and maybe look at my farm and the agricultural industry that I work in, and maybe use my life experience and the tools and the other things I do outside of the farm, and how I can bring that to my farm to cope with those pressures. Because ultimately we have to be honest with ourselves to look after our mental health, and I think I need to be honest with myself as a farmer too. And I'm lucky that I write for a national newspaper, which gives me, you know, maybe opens my eyes to what's happening with farming around the world, and then bring that back inside my own farm gate and take a hard look at my own farm. But likewise, you know, I'm a Tackle Your Feelings ambassador with Rugby Players Ireland, and I often believe we as farmers need to be looking at ourselves as not farmers, we're elite athletes. We have the exact same mental and physical demands as a professional rugby player, yet we just see ourselves as farmers. But when you put yourself into those boots of a professional rugby player, and you look at the tools that they're given to cope with the pressures and demands on them. I think we can learn a lot from them as farmers, but also I think, you know, we do allow the pressures to come on top of us as farmers inside our own gate, instead of maybe looking at it from the perspective, look, I'm farming with 13 years, and how the climate and how the challenges and the pressures have changed in those 13 years. You know, it's amazing what's happened in such a short space of time. I look at mental health and look at so much progress has been made, but I think for all the researchers and the support services in the room, don't underestimate that we must keep that pace going. And I think today is a phenomenal step forward that, you know, the Department of Agriculture and the HSE are bringing so many people into one room and streaming it online, that we're willing to discuss this openly. But I think maybe one of the key points for me as a farmer is, can I sit down in my farmyard and allow all those challenges to become a pressure on me, or can I actually take control? And it was something I thought about between now and last Friday when when a few of us met up to discuss what we would discuss today. And I think actually we can take control as farmers, and maybe we need to get that message out there to farmers that, look, climate change is going to put huge pressure on my farm. Changes in policy over the next 5 to 10 years and changes, you know, even what's happening at the moment and what might happen next year, that's going to put huge pressure on my farm. But and you know, I'm not disagreeing with what you said in your opening statement, that, you know, things that we don't have control over. But actually, I do have control over that as a farmer, in that I can look and see what is going to change in policy, what is changing with climate change, and stress test my farm back against that, and just maybe like analysing my farm from a safety point of view, do a risk assessment for the pressures of my farm, and sit down and say, okay, if legislation was to change around how we manage calves on farm, how is that going to impact my farm? You know, if we had a real poor summer, you know, and I wasn't able to graze as much, I wasn't able to produce as much fodder, how does that put pressure on my farm? And then learn to manage our farms against those pressures, so that, you know, if a policy changes, or we have a shockingly bad winter or a shockingly bad summer, that that we know how to cope with that pressure and what action to take on our farm. And on that note, I am going to shut up very quickly, because I could talk for the day, but I'm interested to hear from the audience today.
Yeah, no, Peter, that's great. And I've heard you speak before, and we might come back to the fact that you're probably the exception to the norm, in that you're aware and you've had a lived experience. That means that you know what the signs are that there's pressure. I think there's a lot of farmers and people who live and work in isolation that maybe don't see the warning signs and don't realize what stress is. So they actually think they're okay, but they don't. If you ask them, are they stressed, they'd say no. But then if you ask them to analyze, are they sleeping properly at night? Is their mind racing? All those key signs. Like, in some ways, your lived experience means that you can identify pressure, and that you're more clued into it than a lot of us probably are at times. Times I don't feel that I'm stressed, but my wife would tell me I've been very difficult to live with for that spell of time, and then you realize, okay, yeah, I am. So it's that awareness thing. It's important. David, maybe I might come to you in terms of the research piece, and it's quantified the incidence of poor mental health on farms, and what the main stressors will be. Maybe just expand a bit about that, because it's obviously the key area of your work.
Okay, thanks for that. Well, firstly, thanks to both departments for organising today. And just to echo what Pete was saying, it's fantastic to see the focus brought to mental health and well-being amongst the farm population and rural areas more generally. In terms of, you know, what are we talking about here? So the population of farmers in Ireland is about 130,000. We've undertaken a few large pieces of research. So what do we mean by large? Well, we have about 800 to 1,000 respondents in each of the surveys that we've done. And that's really, really important. Okay, so what you want to do is get a large number of people responding to your questions, so you can be confident that if you went out and talked to a different 800 people or a different 1,000 people, you're going to get the same answer. Okay, so we call that a confidence interval, and that's the work that we do, we always strive for a 95% confidence interval. So we're 95% confident that if we went out and asked a completely different group of people, we'd get the same answer. There's another element in here, and I'm sorry if I'm boring people with the technicalities, but I'm a professional researcher and this is the job. The other element here is the 5% level of error, okay? Now, the minister will understand this fully because any poll comes out with a health warning on it saying that the poll might be wrong by 3 to 5%, okay? So that means that if I say that that 10% of people experience something, it could be 15% or it could be 5%. But the whole point is that we're confident, very confident, that the true value is between those two figures. Now, in answer to your question, in terms of the work that we've done, Mary Brennan completed a Walsh Fellowship or Walsh Scholarship a few years ago, and she found that 57% of farmers experienced at least one stressor in the previous 5 years. Now, for me, that's not unsurprising. All of us experience stress, okay? And to experience at least one stressor over a period of 5 years, well, we should expect that a large proportion of people will experience that, and particularly farmers. There's so much outside of the control of farmers. So the really interesting thing for me is the other group who don't experience stress, okay? So we're looking at 43% who are saying that over a period of 5 years, they didn't experience stress. And this points to the real positives of being a farmer. And we have work that's been undertaken at the moment by Alexis O'Reilly, again, another Walsh scholar. And he's focusing on those positives. And it's working with animals, it's working outdoors, it's producing food, it's knowing that there's a value to society. And farmers take a huge amount from that. But then we look at who experiences stress on a continual basis. Okay, and what we find there is, and this is work that Diana Van Doren completed as part of a Walsh Scholarship with Noel, and what we find there is 13% of farmers report being stressed all or most of the time. Okay, so there is our problem group. Okay, they're the people that we need to be targeting and helping. And the last figure I'm going to give here is that when we look at well-being overall, so this isn't stress, this is well-being. So am I feeling positive about myself? Do I think I can control what I can do on a day-to-day basis? Do I have positive social ties? Okay, so there's a whole range of questions that we ask around this. We come up with a score for each individual, okay, but then we average that. And what we find is that there are 15% of farmers in Ireland with poor well-being. Right, so that's the scale that we're talking about. Now, if you go back to the first figure that I gave, which is 130,000 farmers in the country. So what we're looking at is somewhere over 15,000 farmers have poor well-being. Now, that's a large number of people, but it is not the majority, and it is not unfeasible to develop supports for those people. But there are a lot of challenges around doing that, and I think Donna and Noel can speak to the challenges of reaching some of the people who need help most.
Thanks very much, David. Donna, how does David's assessment match the kind of research, let's say, on the DCU side in terms of prevalence of mental health issues? And you might touch as well on David's point there around the challenges.
Yes, so well, the big thing that we kind of look at in DCU is mental health literacy. So as you were saying in your opening speech, so people recognizing the signs and symptoms that they are struggling, and then also help seeking. So if they do recognize it is something not right there, going out and seeking that help. And what we found from our research is that, you know, over 70% of farmers that we surveyed said, yeah, they would go and seek help if they were having a mental breakdown. But 1 in 4 actually didn't know how to go about seeking or getting mental health services or accessing mental health services. So we then looked further at, well, you know, farmers do experience a lot of unique stresses, and there are people who are struggling, but actually the uptake of services is quite low. So why is it low? And some of the main things that we found were, well, there's a lack of accessibility or availability of services in these areas. Some reports came back that farmers were prioritizing other things as opposed to their own health. So they may tending to a sick animal, or fixing a fence, or prioritizing things like this as opposed to going out and looking after their own health. Some viewed it as being very time consuming. And then what we also found was a lot had quite low mental health literacy. So they were unaware of the signs and symptoms. So someone might be like, oh, well, I have poor sleep and that's just what I have, instead of actually going, well, hang on, is there a couple of things going on here? I'm having poor sleep, I'm having racing thoughts, I'm very irritable. And actually what we are trying to do is create an education program around educating that mental health literacy side of things. So either farmers recognizing in themselves or recognizing in other people around them, actually there may be problems here, maybe I do need to go and seek help. And then what we're also doing is identifying different services or linking them to farmers. Go, okay, well, if you've this type of problem, what about this type of service? Or if there's this type of problem, what about targeting this area? So informing people of what's out there and how to actually access these services. And we also then did further work on, well, what do farmers actually want? So there's no point in, us up here designing these intervention programs or education that actually doesn't benefit the farmer, or people aren't going to use because it doesn't really suit the lifestyle, it doesn't suit. So what we did with our research is we got the farmer's voice central into it. So we asked them, well, what do you want? How can we address these issues? And some of the key things that came out is these services that we provide, they have to be farmer centric. They have to recognize the lifestyle and the job and what comes with it. They identified that, if there are facilitators, we want people with the psychological background, but also that know and understand the background of farming so that they can actually target this. Other things that came out is, maybe we want to focus on skills. So look at resilience, building resilience, or look at building communication, as opposed to maybe talking about mental health, because there is that stigma that still does exist, which I think might talk a little bit about. So, using that type of language. And also another thing is, well, when we're, implementing these services or these interventions, been conscious of the time of the year, because obviously different farmers will have very busy times of the year and less busy times of the year. So if we are implementing education programs, we need to be very aware of when we do that, so that it's available for all farmers, regardless of what area that they're in.
Yeah, and you've kind of crossed over there on the preventative piece, the well-being piece, as well as, I'm conscious you said early on, farmers said, oh yeah, if I have a breakdown, I'll definitely, like, if I have a breakdown, they're at the end of a process, that there's probably been so many warning signs before that.
Yeah.
And that probably brings me into know, like, the initiatives like On Firm Ground, Farmers Have Hearts, their initiatives targeted towards farmers improving their health and maybe avoiding getting to that end point, but trying to intervene or get some interventions earlier. Maybe give us some background on both of those for people and viewers at home who would be aware.
Farmers of Hearts has been running now for a number of years. There's a number of partners, the Irish Heart Foundation, HSE, ourselves, and others, and it's essentially a physical health program, screening for cardiovascular disease and offering some supports to enable farmers to make changes. One of the interesting things we found, and Diana did really good work on this, in interviewing the Irish Heart Foundation nurses, a lot of the farmers brought up mental health issues at the screening, and what it highlighted was their lack of opportunity to find services, or maybe a fear or a reticence to engage on a mental health issue. But when the nurses were really effective at creating that kind of safety and trust in the engagement on physical health, and that was a catalyst or enabled farmers to open up about mental health issues. And then the On Firm Ground is really important for a number of ways, I think. Firstly, David talked about the farmers who, the 20–30% who may be suffering poor mental health. One of the big challenges is how do we reach these farmers? And there's a term in men's health and other literature, but that's so-called hard to reach groups. So we really need to capitalize on existing structures and partnerships and opportunities to reach out and engage those farmers who are suffering. And farming by its nature is obviously, it's not in urban areas, it's in rural areas. Sometimes, let's say in the west of Ireland, it can be highly, isolated areas of the country. So by equipping the ag advisors, and soon move on to vets and other agricultural workers with basic skills to support farmers in mental health, to signpost them to services. That's really important. I also think the language is really important, and I'd like to commend John and his team today for the language. I think Cultivating Mental Wellbeing is a lovely title. Cultivating to me has connotations of nurturing, attending to something that's of real value, that's really important. Pity if I stole your line. I've learned all of this from Biddy O'Neill, my mentor of many years from the Department of Health. But that's really important, and it's also a verb. Cultivating is a verb. I don't want to get too pedantic now about syntax and language, but it's about action. It's about doing. Mental health isn't static. It's something that we can work on, and I think that's why the voices of George and Peter today are so important, because they talked about practical skills and practical, strategies that they brought to addressing mental health. And when I grew up in a small parish in Han, County Limerick, the only time mental health was mentioned, actually it wasn't even mental health, it was just someone who was mental. That really that stigma, and that's changed dramatically now. But change happens slowly, so there's still a bit to go, I think. My mother would have talked about someone with a mental health issue as someone having a little want. It was kind of nice, soft language, but there's still a fear about it mentioning the dreaded word,
Yeah.
So we need to move beyond that, and that's why initiatives that are, as Danola mentioned, that are farmer-centric, that are grounded in farmers' experiences. Someone called these co-design approaches to engaging farmers, but putting all the stakeholders at the centre. I'm looking at Seamus down there, who I've learned loads from through the Farm Ground programme. The farmers and farm advisors, in our case, bring that core skills and experience, and without that, the programme is worthless.
Yeah, and I'm really conscious the point you make there, Noel, around language. Language really matters, and as a public representative who occasionally is talking about such things, you can, with the best will in the world, use a phrase or something that you think is describing something that can be used clumsily and can have a negative connotation. So I think all of these opportunities to get together gives us an opportunity to realise what is the best way to address
Absolutely.
and to talk through. Peter, conscious of barriers, I stood down in your yard when we launched the initiative that was your brainchild, that you spearheaded with the Samaritans, about ensuring the Samaritans number went on every milk lorry that went into every farmer's yard in the most isolated, hard to reach areas in conjunction with Dairy Industry Ireland. You identified that it's the hard to reach places and those elements that need probably to get the message earlier. What do you see as the barriers, both for somebody who feels they need help but doesn't know how to seek it, or also the barrier for someone to identify? Like, as I say, I think you feel confident that if you were coming under pressure, you would identify those signs, and you have a family support network on your farm. Not everyone is lucky enough to have that. Might be in more isolation, be going back into their house on their own at night. What are the barriers for them to identify those, and also then make that first step?
I think maybe one point that is worth making to any farmers looking in is, while I'm extremely good at managing my mental health, I will also push myself to the limit, which is wrong, and I really will. And I see that at times, and I say I've gone a step too far here in how I've pushed myself physically and mentally. And I suppose to put it into simple language, I need to give myself a kick in the ass and say, right, take a step back and have a long, hard look here. But I think the barriers, and Noel referenced it there, stigma. And maybe for us as farmers, we don't understand and how much the stigma has been broken down. And I'd like to reference back to On Farm Ground, because I think that is a game changer in this country. That so many people, and bringing it to the next to the next phase again, that so many people that are interacting with farmers are being trained up, are understanding, and I think we need to shout that from the rooftops to farmers to help break down that stigma. That I suppose, look, as a farmer, I dread seeing that HARP letter come in through the letterbox, or would feel that I should dread interacting with Department of Agriculture staff, where for me, it's quite the opposite. I know, that they are mindful of pressures that farms are on, and I have an extremely good working relationship with all of those people, and I think it goes back to how we need to see ourselves as elite athletes from the point of view, there's no one rugby player going to win a Rugby World Cup. It's a team event, and it's when you're sharing the pressures with that team around you, and that's your agri advisor, your cooperative, your bank, the Department of Agriculture, that somebody out there has a solution to a problem, and when you're willing to share it, you can overcome it really quickly. So I think maybe one of the biggest challenges is that we as farmers still we're holding on to that stigma too much, or maybe not aware of how much has the progress the industry has made.
Yeah. And I think, like, if we say physical health is the same as mental health, it does strike me, we all hear those stories of people we know that have that physical health symptoms, but that really worrying period where they're waiting for a diagnosis of what is actually the cause and the problem, and access to which is the right consultant that I should be under, or which hospital or which specialist should I be dealing with. And once you get that, even though it might be a bad diagnosis, there's actually an element of relief. At least I know what I'm dealing with. I'm on a road and I'm bad. Mental health is not different. It is that case of identifying first and foremost that you are displaying symptoms, that is, your mental health is under pressure, and that you need to address it. And then once you get in with that professional in whatever guys it is, the pressure lifts in that, okay, I'm on a process here now to work through this and to identify, and what I'm experiencing is not unusual and has actually been experienced by so many more people. And it's
and sorry to cut across, but maybe just and I would like to echo that I've said it publicly before, the Department of Agriculture staff are very mindful, from a TB perspective, but from so many perspectives, sometimes they may be portrayed as, are seen by us farmers as out there to get us, but they really are not. And that's not just down to one Department of Agriculture vet. I know vets right across the country, and they are so aware of the pressures and challenges farmers face, but also so conscious of how, when you work together, you can overcome that challenge. And I always look back to, we had a big TB breakdown in 2014, and I possibly could have sat down in a corner and said, bugger TB testing and the department vets, this is crucifying our farm. And I worked really closely with two Department of Agriculture vets at the time, and I know we work closely with another one, and we got on top of the situation and we knocked it on the head within 12 months. So it's something we could have let linger, and previous to that, our farm had a TB breakdown every 3 years. But because we worked together as a team and looked at different aspects of what we could do and how we managed the farm, but also in testing extra stock, that our farm hasn't gone down since.
Yeah.
And it's
yeah, no, and I'm acutely aware, like, we have a farm at home myself that I took over from my parents, and that myself and my wife still manage, and nothing will instill fear in a farmer more or cause stress than the word inspection. I think we're acutely aware of that, the Department of Agriculture, and we will continue to work to make sure that our inspectors are those who front-facing staff in the department. And you see it at the plough match, the relief the farmers have when they get that chat and get to discuss the small little impediment under mapping or something that gets to take that problem away, and they've had that pleasant experience. That's really good. It's our job to ensure that that's always the experience, and that it comes in that way. But similarly, Board B staff come to audits, I know, sorry, neighbours, and that who are awake at night before the Board B audit on the quality assurance, and then afterwards are saying, God, they were trying to work with me through the few challenges, and that just tells you their starting viewpoint was, this person's going to come in with a big stick. On that point, and those connections, but also the fact that, David, that farmers aren't a uniform group. There's a wide variance between age, gender, not as much variance in gender as we'd like, but we're working on that. But also in terms of enterprises, does the research show that there's a very big difference in stressors depending on those?
It does. And what we find, the least stressed out farmers are sheep farmers. Those people who have an off-farm job tend to be less stressed. So we can see differences in terms of that type of variation. In terms of the farmers who experience most stress, they tend to be dairy farmers. And that relates to a couple of things, but basically weather, so a lot of uncertainty there. Workload, generally very high levels of workload, particularly at certain times of the year. And then you've got money. Okay, so they're the key stressors that kick in for a dairy farmer. But when we analyze the data, we find that the income side, so this is the work that Mary Brennan did as part of her PhD, the income side actually offsets. Okay, they're making enough money that they're able to say it's worth it. Okay, now Pete might completely disagree that you can go too far on that. But going back to Pete's point about getting help and the professional help, if you think about those stressors, those key stressors, there are Teagasc advisors and there are private consultants, and there are vets and there are banks. There are professionals out there whose job it is to provide advice to farmers around all of these issues. And these are occupational stressors. And this is the challenge for a farmer frequently, is to say, I actually need advice on something to do with my profession. And that's really difficult for many farmers because there's a culture of self-reliance and a feeling that they might be letting down themselves or letting down the family, and they don't want to be seen to be asking for help on a technical issue, that because they're a farmer, surely they know. And the reality is, as Peter said, things are changing so rapidly all the time that there is that need for farmers to get information and advice that can help them. And as I said, it isn't from one source. It could be the bank, it could be a Teagasc advisor or a consultant, a vet, it could be somebody in the department. And being in a position to access that information and then figure out how it's applied to their farm is a critical step. It takes that stressor out. And where this becomes really problematic, and everyone can relate to this, if we all have one stressor in our life, generally we can cope with it. But it's where you get 3 or 4 that come together, then you can get overwhelmed by it. And this is where if we can be proactive and farmers can be proactive, it means that we can keep on top of a lot of these stressors and try and manage them so that they don't become problematic.
Yeah, and that is very much trying to nip it in the bud beforehand and getting that part done. Mindful as well that like loneliness at times in Ireland across society, and you don't have to live in rural Ireland. Canvas and you get a real insight into people's lives. I've knocked on doors in middle of housing estates where the door opens and the person keeps talking, and it feels like a cold house behind, and it's a quiet house, and they just don't want you to go away. And right next door in the middle of this busy housing estate is a mad house with 3 or 4 kids running around, warmth, firelight, and activity, and everything. And you realize that person lives surrounded by people but is lonely. So you don't have to be in isolation, but being in isolation, living on your own, working on your own all day, not engaging with people, is a huge challenge. Does that come up in your research in terms of then David's reference to the off-farm job having an impact because you're dealing with people in your other job or in your other aspect of life?
Yeah, well, yeah, I suppose just first like on that isolation bit, absolutely, like we were finding that was a kind of a big stressor, that those long working hours and that working in isolation. And actually in terms of like seeking help, what we found that what a lot of people are currently doing, or a lot of farmers are currently doing, is releasing their stressors onto their spouses or family members or local farmers who they can kind of share and relate to, who maybe are in similar situations to them. So, you know, if you have an isolated farmer who also is aware of another isolated farmer, then, you know, maybe that's a bit of a support network there. And actually one of the things that came out that farmers wanted in terms of supports available is this idea of you know, community champions. So if they were getting real life stories from farmers sharing their experiences and what they did and what they went through and how it was a positive experience for them, that would really actually help them in that situation. So I'm not sure if that entirely answers the question.
Yeah, no, it does. And like the other thing that strikes me as well is like we all know farmers are hugely influenced by what their neighbours do and think. And part of the reason that they don't reach out for that advice and stuff is, God, if the neighbour sees the specialist driving up telling me how to farm, then he obviously thinks I'm bad. That all impacts. Similarly, like farmers generally don't dream to take a Wednesday afternoon off because, oh, sure, I should be working today. Now, all their neighbours who aren't farmers don't work on the Saturday, Sunday when they're working and they're milking or they're doing whatever. But they still feel I'll look like a lesser farmer, that I'm not working hard. And actually at our conference last Saturday, Kevin Moore, a great young farmer from Mayo, had a great statement that just about someone saying to him, just because you finished at 5 o'clock in the evening and you've been well organized to do that, doesn't mean you didn't work hard. So this sense of trying to change that, and the thing in Mehel, is there more we can do from a community perspective to encourage farmers to come together, to convince each other, like it's okay to take a few hours off to do something that is just gets you away from the farm, that gets your head clear away from, if the farm is the cause of stress.
Absolutely, and it's actually, you know, very interesting what you're saying. What we found one of the key barriers as to why people maybe don't go and seek help, well, one was resilience, but another one was that pride in being a good farmer, in that I can deal with it. And that is actually a barrier that's preventing farmers from seeking help when they do recognize that they need it, they don't want it. So again, in terms of providing those supports, like, so they identified they wanted formal supports in terms of helplines, which were, you know, provided by people who understand the farming background or from a farming background, but also they wanted informal support. So community and social events within the community where we have farmers talking about their experiences, and it's farmer based and farmer led. But also they said that it doesn't have to be all about the work either. We like where we can have that separation out, where we can have a social event that doesn't necessarily have to be about the work, but it slowly allows that opportunity to build up relations and build up trust with people, and allows people to share their experiences, which is going to make it more acceptable and more open, and less stigma around me sharing my experiences and, you know, what I'm experiencing or what I need to do or where I might need to go to get help if needed.
Yeah, no, absolutely. And just to say, Noel, I want to come maybe then on the role of government and state agencies and how they can kind of fill that void that are the opportunities there that Donald talks about. But just to say, I will be going to the audience after this because I'm conscious we've chatted among ourselves here long enough. And for people watching online, there is a facility there to raise questions or points as well. And we'll try and deal with as many of them as we can. But just on that point, Noel, where Donald talks about what farmers have identified as where they would kind of like support, how can we as policymakers, as government, as agencies, as academics across all the spheres, farm organisations, recognise a number of farm organisations represented here today as well, what can we do to help fill that void?
There's a couple of things I'd say. The first is just to acknowledge how things have moved forward. When Billy and I were doing the consultation process for the men's health policy 17 or 18 years ago, and we visited other government departments, most of them were looking at us and saying, well, this has nothing to do with us. So if we take what the Department of Agriculture is doing, and I'm not trying to plumb off the minister because he's here beside me now, but like a lot of really positive change has happened in terms of funding the programs that we've mentioned. So that's a huge positive start. I think we need to look at it in two ways. One, we need better services and supports in rural areas to support those that are in distress. But that's just the tip of the iceberg, really. What we need is more support for connection, breaking isolation, initiatives like the Sheds for Life, the men's sheds, for example, community supports and activities that bring people together, that combat isolation, that get men and women, not just men, talking and have an outlet to get support. That's really important. And I think the interdepartmental approach is really important. And again, that's why the Farm Ground program in particular is so commendable, because you've got two government departments coming together, both with different kind of statutory obligations and remits, but working in partnership with other agencies, you know, to solve a problem, to support farmers, and then putting farmers and farm organisations and farmers' partners and wives and husbands at the centre of the solution. And Daniel talked about this as well in her work with DCU. Not presuming we know the answers, but really, you know, doing that critical consultation work and involving the key stakeholders in program design and implementation is hugely important.
That's it, exactly. So making sure that any interventions on a policy level are fact-based, are based on research, that because it's very easy to think anecdotally that we think we know what the solution is, we think we know what farmers want or what people in these stressful situations want. But
the other point I was going to mention as well, I think sometimes we mental and health services are kind of siloed from other services, and really we need more integrated approach. And I know this from experience. I was diagnosed with Parkinson's disease 12, 13 years ago, and I see a consultant twice a year, and it's essentially for physical ailments. But I mean, there's a huge mental health challenge with that as well.
Yeah.
And I'm not sure what the solution there is, but it's just to acknowledge that the health is holistic. You know, so it can't be segregated into or compartmentalized. We need to address it in a more holistic manner.
And actually, whatever stress you're dealing with in life, whether it's a health diagnosis or anything else, there's going to be a mental health implication to that, and even to support somebody to have the resilience to work through it,
Exactly, yeah.
and to understand again that
without necessarily labeling it as a condition.
Yeah, and I think that's where Healthy Ireland comes in so much. Biddy, acknowledge your presence here, and I know you're on the next panel as well. But I do think that interconnectedness between the state agencies is really important. Like Healthy Ireland is a fantastic initiative by government, but not one that has a massive budget, but has an area of expertise, links in with the HSE and all the different elements there. Whereas, you know, getting the dedicated ring fence funding within the Department of Agriculture was a top priority for me when I got this role first, because I see it as my legacy. I see it as something that beyond the time of the work we do now,
yeah, absolutely,
woe betide any minister comes into this role down the line and doesn't continue to have that fund.
Sustainability.
So that's something then that other state agencies and other non-state agencies who have availed of state funding from the department know is there, and they can design and develop programs around it. That's where our EIP programs, the innovation partnership projects that we had around the country around farm safety, some of which were focused on mental health, were designed to kind of get groups and bodies to realize there is a pot of money here, that if you come up with a good locally led idea, then we can support it and see from that the learnings that we can then extrapolate out and hopefully bring out across all policy. I'll open up to the floor here, very conscious of a wide array of people here and online. So if anyone would like to ask a question, by all means, we get a microphone to them.
I compliment you having this thing today, but there's a big problem out there with the single farm payment. I know you might say it might not have much to do with this, but you're a department official, and as a farmer, it takes you 1 hour to get through at least. And during that hour, and if you are in bad health, you surely be bad health when you're finished with it. During that hour, you'll hear, first of all, you hear Irish, then you come on and you'll hear leave a message, and then you'll hear music ahead, and all our operators are busy. And this is constantly going on. Now, I'm in this position myself. I leased entitlements, I sold entitlements. I'm in partnership with my son. Half my entitlements was solved or sold and or put on the other people's name. The other half was left there. So I left messages on the phone and everything, but no department official rang me back. So eventually, after I was in a mart one day and I decided I'd leave the mart, I was in that bad a form, like I'm only after suffering 2 heart attacks and I'm under enough stress as it is. And I decided to leave the mart and sit in the lorry. I sat in the lorry for surely an hour and 10 or 15 minutes trying to get through to him. Eventually I got through to a department official. I'm not blaming all the department, but I got through to this department official. And he told me it was a bug in the IT system. That was the cause of it. And I says, when would this be solved? And the words he said to me back, he says, I don't know. Well, that's not good enough for me. I have banks to pay. Yeah. I have everything, different bills to pay, myself and my son. I need me money. Now, it's not my fault the IT issue is. Yeah. It's the department's fault, right? Suppose you break down tomorrow morning with the car on the road. What is the first thing you do? You go and get a garage man, you get fixed. Well, the department should go and get the IT system fixed.
Fair enough. And so the one thing I'll say on that is, and I absolutely accept farmers at this point in time in terms of the farm payment system, and obviously we've had the delay this year because we're in the first year of the new cap. The pressure on the system, the pressure on the officials actually to design whole new computer systems for the first year is a very big issue. There is huge stress there for everybody, and I understand the pressure on the farmer side, because the farmer owes the merchant, owes the contractor, and once it's announced that people have got paid, the contractor and the merchant presumes the farmer's paid. So they think you're withholding, or they think you're after settling someone else's bill and not theirs. So the pressure all piles on. And that's why we're working through that as best we can, and obviously trying to work that. But it is the sheer volume of calls and stuff at a minute, and it's to try and get through them in as quick a time as possible, and to be as clear with people as possible that about the percentage of farmers who haven't got sorted on that. And I know that is a very big challenge that we work through. It's the cycle of where we're at. The first year of a 7-year cycle, or 5 years after the 2 years extension. It is something that we'll have those payment dates back next year, and we're, everyone's working might and main to get through those problems as quick as we can. I know George Graham had his hand up down there as well, but thanks for those points and articulating them clearly here. Yes, George.
Yes, Minister, the panel, ladies and gentlemen, it's just more of a comment than a question. Firstly, I think what's happening is working, will work, and will get there for the simple reason I think it has been looked at very differently and has started at the grassroots and involving people who are down in the very bottom, like myself, at the bottom of the barrel. We're prepared now to discuss things, talk to people like that, and use some of that information. I can talk about mental well-being, mental health safety all day, but I cannot do what the panel can do up there. I cannot put the statistics together. That's not my scene. So I'd like to compliment the people involved in organising this day and doing that on firm ground. Luckily, from awareness head to toe, I've been involved in some of them things, but I think they're prepared to look at all aspects. In other words, there's no point in trying to fix the branches on the tree if the problem is down in the root. I think the people and the powers to be now have decided to look and talk to the people and look at grassroots and bring it up to the top. I think in general, years ago, it used to be the other way around. We wouldn't talk about it, but it'd be only a certain core of people could do it. But I think everybody has been involved, and I think that's where this is going to win. The previous speaker, I certainly can understand them, but in fairness to that, I've been involved with people with the department, and when you sit down and go talk to them, and the secret is to talk to them in time, they are prepared to work with you. I remember years ago, there's no way would talk to the Gardaí. I've talked to banks that have asked me to talk with them, different things. I'm a person that practically never went to school, but neither could I learn in any university what I've learned by going through what I've done. So that's the big thing. But I'd like to compliment the people for putting this together, the Minister and the panel for being here. I think you've started in the right place. It's walking to the top. And none of these things happen like that by clicking your fingers. It does take time, but it'll work with everybody working together. Thank you very much.
Thanks very much, George. Points well made about certain pressures coming in, and sometimes we can stick our head in the sand and think they'll go away, and then that pressure only builds, whereas that first conversation can be the big releaser. Pat Griffin there, HSA, not to put you on the spot, but obviously a lifetime of work in the area of farm safety. You might talk to us here around the connection that you see between farmer mental health and well-being and farm safety.
Yeah, thanks, Minister. I had my hand up to make a comment anyway, but I'd like to congratulate the department and the HSE on today, and publicly thank George Graham and Finola for making that excellent video with us. I mean, I've looked at this area of farm safety more so than farmer mental health and well-being for many, many years. It's really only in the last 3 to 4 years that we've started to focus on well-being and farmer mental health. And I was struck by what Peter said about, times farmers can get under pressure and really be in a difficult situation, and a TB, going down with TB is absolutely one of them. Or when the fodder crisis was there and farmers are listening to animals crying for food and they didn't have it, or the land is flooded and crops are lost. I mean, these are huge stressful situations. But I think the biggest stressful situation is when there's a fatality on a farm. The stress that family goes through at that period, and our inspectors have seen it, and thankfully there's Embrace Farm there to help them. So there's a lot of situations where farmers can get under real difficult, stressful situations, and they need the assistance that all these organizations are establishing. And it's wonderful work. It's really wonderful work that it's starting to be developed. But I would ask the question, are we getting it right in relation to when the farmer eventually decides I have to pick up the phone. And you know, as David points out, there's, you know, maybe 15% of farmers that will get to that level that they really need help. And when they pick up the phone, it's so important that the person that they speak to understands what they're saying. If they say, the herd is broken down, or I'm locked up. And if they have to start explaining these terms to the person on the end of the line, I'm afraid they'll just quickly put down the phone. So I really think with the level of stress and suicide, unfortunately, in agriculture at the moment, we do need dedicated lines where a farmer picks up and speaks about these things, and he doesn't have to explain, he or she doesn't have to explain it. That's critically important, because if you lose them at that stage, you know, the consequences can be dreadful. So that's where my focus is at the moment. I would say huge amounts of good work happening. But when that person goes and takes that difficult decision to make that call, we have to get it right, because that's where things can be solved or things can go very wrong. Thank you.
No, absolutely. It's such a huge opportunity for someone to come in. Fionnuala?
Just maybe, I don't know that I have the answer for Pat's question. Are we getting it right? I think we're getting it right because we started, and we started years ago in Teagasc and yourselves. You'll remember the years down in the National Ploughing Championships in the world. We were there with our stress information, and gradually it opened up doors. I think a key point made as well, I think Dr. Richardson made the point around the literacy. And you know, the way we had the old language, there's a little want there, or they're gone to Mullingar or whatever. We all kind of had a negative image learning about that. So, and I know there's a big emphasis now about health literacy, but we need to ensure that that health literacy covers the language around mental health and recovery, so that people know it's not a lifelong. Like I phoned somebody accidentally. Well, he phoned me, just tells its own story. He phoned me and I returned the call, and I said, I had a missed call from me, and then he said, who are you? And I said, Fionnuala Colgan, Development Officer, Mental Health Ireland. And he said, no, I didn't phone you, but like his name, number, everything had come up on the phone. Then he said, where do you work? And I said, Mental Health Ireland. Oh, thank God, I don't need you. What had happened was I had a number to do with my husband's business on my phone, and he was looking to contact my husband, not me, but ironically enough involved in farming, and I did have reason to meet with him. So I just think we need to get our, you know, people have that negative attitude, and like they don't leave a cow get sick, they don't leave the tractor break down, they go and get that. So, and I'm involved with a European project called Farm Resilience, and there's partners from Finland, Belgium, Germany, France, and ourselves, Spain. And the one thing I've seen from the case studies we've been doing, because we all had to offer 4 or 5 case studies, and George was very supportive to me, and I appreciated that, George. You know what, we all have the same problems, whether we're in Ireland or Finland. It's just maybe the terrain is different, but everybody is struggling in their own different way and trying to get the farm thing together correctly. So I think we are on the journey of recovery in that regard.
Thanks, Fionnuala. Hugh, 1 second. Number 1, Embrace Farm, and then we go to Hugh.
Yeah, I guess in my capacity in Embrace Farm, I suppose supporting beef farmers, but I'm also married to a dairy farmer, and I suppose over the last 12 years we have experienced a lot of stress on our farm between the death of Brian's dad, we've had TB, we've had inheritance issues, all of those things. And I guess looking at my husband in his 40s as a farmer, they tend to operate on their own. And when we speak about farm safety, it's not just the farmer's problem, it's the entire sector around them. And I would say around the mental health issues as well, is once the sector around them is supporting them and showing that they have somewhere to go, somewhere for that support to get, I think is a good help for them, and not have them feeling on their own. I'd like to echo what Pat said there about, you know, having, when they ring up people, that there's somebody at the other end of the phone line that knows what they're talking about and can actually respond to them and relate to them and speak the same language as them. That's a great start.
Thanks, Hugh. Hugh Farrell, ICSA. I'm going to go back to the panel now in a second.
Thanks, Minister, and to the panel for giving us this opportunity to hear our views, our opinions. And I was just listening there to the speaker there from Cork, the dairy farmer. I can't think of your name at the minute, sorry about
Peter.
that. But you're talking there, and David there bringing in the thing on the milk lorries and the Samaritan number, you know, and thanks. There's an awful lot of other services going into every farmyard. There isn't dairy farmers that needs the same service and needs to be invented, and maybe add that to it.
Yeah.
And I think needs to be monitored what phone calls coming from farmers to the Samaritans, and do a report on that on a regular basis. You talked, Minister, earlier on about doing the canvassing, and people on their own in a cold house and another family. But there's an awful lot of people in isolation within the family in certain cases, and we are dealing with that. We represent farmers there all the time, and as you mentioned there, the TB earlier on and different things. I think in cases there where someone isn't able to answer back, and I see different bodies here sitting right and left of me, belong to farming bodies, and we're all there to answer phones and help as well. That's what we're there for too. And why we're not more united or being brought together as a group, working groups together, and I think that is more important, to be honest with you.
Thanks, Hugh. And hand down here.
Hi, good morning, everyone. I'm Sarah O'Toole. I'm the Executive Director with Samaritans Ireland, and delighted to be here today, and thanks for the invitation, and thanks to Peter for his great support. I suppose one thing that struck me is a speaker talking about the farmer voice and being farmer-centric. One of our key goals is to ensure that we reach people who need us most and reach those in isolation, particularly those in rural settings. And what's really, I know just from the previous commenter there about who is calling us and why people are calling us, data here is really, and research are really, really important. They're important. It's really important to Samaritans, so we understand who our callers are. And I get the point about when someone at the end of the line knows what you're talking about. We try our best to make sure that our volunteers are so well trained that they understand the issues that are facing people today, albeit from a farming background or a city setting, whatever. It's normally, we commonly share the same challenges around mental health, family relationship problems, work problems. So just really wanted to say thank you to the department as well for all the support that you give Samaritans to ensure that we are there for people at the end, and hopefully there before a problem becomes too big. So I'm really interested in around that 15% mark, that once people identify there could be an issue, that they're able to reach out. And I think with taking that inclusive approach, that its solutions are driven by farmers themselves, what they actually need and how we can actually meet that. Thank you.
Maybe just one thing I'd like to throw to the audience, because I've heard the panel mention it and people on the floor mention it, and that's resilience. And that goes back to, look, and you know, on firm ground is so positive, but I think possibly we need to look at, as David said, the farmers that don't feel stressed, but build resilience within that cohort and the young farmers. And I would really love to hear what the audience thinks of this from a perspective. I go back to the elite athlete thing, right? The Irish rugby team has been so successful because they put a huge focus on their mental game as much as their physical game. And when you say to a young farmer, you cannot work 365 days a year. You know, if you're going to be a spring calving dairy farmer, that is when you need to be at peak performance. You know, you need to take time off farm. You need to learn to be honest with yourself and give them these resilience tools and bring it to discussion groups and stuff, and say to farmers, look, make no mistake, this is one of the best jobs in the world, but it is really going to push you to the limit and challenge you within your farming career, so that when you have all those simple tools to cope with your resilience, you know, if you have a TV breakdown, or you have a really bad year weather-wise, or there's a really the milk price takes a huge hit or whatever, that when that challenge comes, mentally you're in such a better place to deal with that. And I'd also draw reference within that resilience to what something David said the other day, and it goes back to the UCD research, that farmers are being really stressed by how they are being portrayed in the public.
Yeah.
And David has the research on this, that the public are really behind the farmers. It is a small voice of people on social media and within the media that are bringing a lot of negativity towards agriculture. And I always look back at that from a perspective of, if a professional athlete performs really badly on the pitch, right, they're going to get cremated on social media. But they are taught not to let that influence their mind. And I think there's so many aspects of that resilience and resilience tools that we need to bring to farmers so that they don't become the 15% that are really challenged.
I think you're right, because ultimately, like that negative, any meeting I have with farmers, public meeting, it always comes up. Everyone that's down on us in the media, they feel undervalued, which I don't believe they are by the general public. But that sentiment, if you're sitting in your tractor and you're on your own all day and you're listening to this radio interview that has somebody saying, oh, we just need to cull all the cows and, you know, go back to subsistence farming, then you're not going to feel valued. But I, on one hand, I think we're very close to turning a corner on that. We see a reduction in our trend of emissions. We're going to improve water quality, and we'll be probably the sector closest to reaching our national targets of 25%. And any of the energy, transport, or any of those sectors, we're going to be a long way there because farmers are up for that. So I can see that narrative changing, but I think we have to accept that narrative, that core to people who are making that argument on social media or otherwise. They're not going to go away. No. We just have to get better at responding to it and telling our story better. But we have to have the resilience of dealing with it. When you talk about elite athletes, one of the most important things you're taught in peak physical training is rest. It's a critical part of it. Rest away. And we all know farmers who are addicted to farming, and the farming is everything that they do. So then they lack that ability to step back away from it when something goes wrong. Whereas there are other farmers who farming is everything they do, but they're also passionate about GAA, and actually going to the match at the weekends or whatever is their release outlet. So maybe part of this is teaching farmers to make sure to have that release valve that is away from the farm, that they're not so dependent on it. Donna, do you think there's the space for us to do more in that area?
Yeah, absolutely. And I think it's great, Pete, that you referenced the elite athlete, because myself and Siobhan O'Connor came together to work in this area. So Siobhan's from a farming background and I'm from a sports psychology background. So this idea of performing under pressure. So, you've absolutely summed it up perfectly there. But as you said, farming is your life, but it's having that other activity to allow that outlet so that you have something else to go to is so important to. And that's the exact same thing done with elite athletes, that you don't create your lifestyle around just your sport. You have something else that's that outlet to give you that rest and that break, exactly like you mentioned.
Yeah, a key part of it. David?
I just wanted to make two quick points. One, the research around the consumer's perspective of farmers, unfortunately not my work, so I can't take credit for it, but thank you. That work was done in NUI Galway, and very interesting piece, because what it highlighted was farmers thought that the perception in general was very negative from the general population. But when the general population were asked about their perceptions of farmers, it was positive, okay? And farmers were valued for a whole set of reasons, from the basic side of it in terms of putting food on the table, to the environment and the landscape and maintaining cultural heritage and so on. The second point I wanted to come back to is around suicides. And myself and Anne Markey are doing a bit of work at the moment on the suicide data. We'll have it complete shortly enough. But what that shows is that, yes, the numbers of people who die by suicide who are farmers in Ireland is higher than the number who die in farm fatal injuries, okay? So there is that element there. The other piece to note here is that when we compare the rate of people who die by suicide who are farmers to the general population, there is a slightly higher rate amongst farmers. Slightly. It is not dramatically higher. It's not radically higher. It's slightly higher. And it varies from year to year. We're working, that's the part we're working on at the moment. Yeah. So that it's to determine whether there's a significant difference. And it looks like in some time periods there may be. And one of those time periods relates to the massive dairy expansion. And what's interesting about that is if we go back to that period, it's also a period where we saw a very high level of death and injury on farms as well from occupation related incidents. So in terms of that suicide piece, it's just really important to note that the rate for farmers is higher than the general population, but only slightly higher. The other aspect of it that we're working on is understanding the age difference. And this is where for the Samaritans, I mean, maybe you can confirm this, but maybe it's important as well in terms of knowing about it. It seems that the death by suicide rate is particularly high amongst farmers over 65 years of age. And this would be substantially higher than the average population. Okay, so there's something going on there. And it could be a classification issue. And again, this is quite technical, but farmers are not seen to retire. So they're always counted as being a farmer, no matter what age they are. And when the statistics are put together, if someone has died by suicide, they're, and it doesn't matter what age, they could be 99, they could be 65, they're classified as being a farmer. What we're working with the CSO on at the moment is to find out, is the same true of a researcher or a teacher? Do they use the same occupational classification? So if I'm retired 10 years and I die by suicide, am I classified as being a researcher or am I classified as being retired? So this is the type of stuff that research does. It's this sort of technical, getting into the weeds, trying to understand what's going on. But the data that we have tell a particular story whereby the suicide rate amongst farmers is not substantially, it's not dramatically higher than the rest of the population. And for me, that offers hope. It means that if we can target the supports in the right ways and in the right places, using the approaches that Donna and Noel have talked about, we can make an impact.
Yeah, absolutely. I have a couple of questions still to take. I want to bring Noel back in. The point you made about dairy, and Norma acknowledged the great work Embrace Farm do, and delighted to be able to partner with you on a couple of initiatives. But actually, it's your comment as a dairy farmer's wife that it strikes me the most. I made the point before, one of my best friends, not to identify him, doesn't live in Kildare, so another part of the country, and we're very close. And everybody praises him for being a brilliant dairy farmer, because he is, and he runs a fantastic enterprise. But the person that I have the most admiration for is his wife, because she's at home in the house with their 4 kids, and she doesn't see him very often. And my wife laments me going to Dublin a lot and politics take me away, but she makes the point to my wife that she probably sees more of me than she does of her husband, who's only across the field, but is constantly wed at that farm because they've got big and labour shortages and all the pressures that are in that space. So that is a very big challenge for us in that space in different bits. Francie Gorman, IFA, great to have you here today.
Yeah, thanks, Minister. I suppose a couple of take-home messages for me here. Firstly, my mum was a nurse, and many years ago, a friend of ours suffered with depression badly, and I always heard her making the point about depression, mental illness, that it should be treated no differently to a common cold, and treated the same way, and destigmatise it. So look, the likes of Peter, David Kerr would be a dairy farmer here in County Laois, would have spoken extensively on it as well. We need people who have the courage to stand up and tell their story and destigmatise it. That's hugely important, I think, because people won't come out. That stigma does stop people coming out looking for help, no question. So after that, for me, it's about the cause of it. And Sean referenced it earlier. There's no doubt, like, you're dealing with banks who, the personal way that you dealt with banks or department or whoever 20 years ago is no longer there. And I'd say there's a lot of farmers in a certain age group, and one of myself, that struggle to go online, do my business online. You're a farmer, you're a mechanic, you're a builder, you're a secretary, you're a vet. In ways, you have so many different tasks to carry out in the farm, and when you go on the phone and you can't get somebody, you're gone out, maybe you don't have the mobile with you, or someone doesn't have it, you miss a call. If it's only ringing a tag company looking for tags for cattle, everything is done online. And when you hear, what you continually hear is why it can't be any other way. So we need to look at the causes and see, like, the payments one is an issue. Well, we can't have our payments because we're devising a new system and it's going to be next year before it's right. Like, it's not good enough. It doesn't wash with farmers. And it's the same with banks. You can't get through to a bank. If you owe €1 million, you will. But if you want a 10,000 loan for a machine or a 30 grand of a stocking loan, you can't get to talk to anybody.
Yeah.
So that's what causes the pressure. So we need to look at how we can alleviate the pressures. We need to look at how we can destigmatize it. And for me, they're the key issues that we've got to address.
Yeah.
And look, I think unquestionably this initiative is very, very welcome. There's no doubt there's a huge problem out there. And I think the resilience, Peter mentioned it earlier on, I see it particularly with young people today. There's a lack of acceptance in not getting everything they want. And I won't, it's maybe...
My eldest of 4 children is 9, and we have that in our house as well. I think you're talking about older children, yeah.
I have a 9-year-old as well, the only one we have. So I know, and I see it even at that age. The acceptance of not being able to get what they want. It feeds up along, whether it's the girlfriend, the car, the farm, the house. I struggled for all them for years, so I know what they're talking about. But we need to go and look at what more we can do in the schools and build that personal resilience in among our younger people, because the level of suicide among young people in rural Ireland, it's frightening at the moment. So I think the schools is an area we should be targeting and try and build that resilience in to people from a much younger age.
Yeah.
But well done in the initiative here today, and keep building on it. It's well worthwhile.
I know that's a key focus of the Department of Education as well, around resilience. A lady there in the back, and John Enright as well, the ICMSA I want to bring in. But just to say, Francie, I think you touched on one point. Probably a particular focus of this morning from our perspective has been the state agencies, the HSE, Department of Health, Department of Agriculture, what we can do. There is a whole other space here that private industry can do, the banks, the co-ops, all the other people that farmers and rural dwellers are dealing with, and the need for them to have that corporate social responsibility and that understanding of the stressors as well.
Yeah, hi, my name is Sinead Grimes. I work with Forum Connemara. I was lucky enough to be one of the project leaders on one of the EIPs you spoke about. We worked with 250 farmers in Connemara, and we had George up doing sheep shearing. And while we first of all concentrated on the health and safety on the farm, what we were working on really behind the scenes was, we used to call it mental health by stealth. So we'd have the training and the workshops, 45 minutes, and a 2-hour tea break where the chat and everything happened. And then bit by bit, when we had the relationships built up, that's when we really started working on the mental health aspect. So we did 45 one-on-ones just solely about mental health. And from that, we were really asking the question, what's needed? What worries you? What's the problems? How can we address it? From that, we did do this, I don't know whether to call it a magazine or a booklet, but it's farmer led. And I think that's the difference. Like, you'll see there's no photographs in there, because like what they said to me was, all the photographs are farmers with dungarees and they look like they're from America. So that's my farmers, that's their tractors, their watercolors of them. And as we like to say, it's farmer proofed. The other thing that Norma addressed it there, what we tried to do is educate the whole community. We took a community-based approach. We did a radio show, we did a weekly column in the Connacht Tribune, just talking about mental health specifically for farmers, because you can't support a farmer unless they're supported by their community. So again, we'd love to see that, and we'd love to help you spend that $2.5 million if there's any left for us. We'd love to keep going.
That's spent. Next year.
Any left over?
No, thanks very much, and well done on the project over in Connemara. It's excellent. I'm out of time, and I have people waving at me here to say that I'm supposed to wrap up. But John Enright, ICMSA, and then I'm going to come back to the panel for a final wrap up.
Thanks, Minister. I suppose just to firstly agree with Peter on his point about the letter with the harp. I think we always and regularly get letters or phone calls from members. They've got a letter in the post and they're literally petrified, to be quite honest with you. And you do try and reassure them in relation to it. And generally 2 days later, they'll ring you back and they'll probably, not always, but most cases, wasn't as bad as I thought it was going to be. But, you know, there's 2 or 3 sleepless nights there, and it has a real impact on people. I think we just need to be really conscious how those letters are worded. I understand the legal requirements, etc. But it's something we need to look at. I suppose the other comment, I suppose, members would ring us under pressure, for want of a better word, and we would refer them on to other organisations, and generally that works very, very well. But the one comment I'd make is that, you know, if a person doesn't ring an organisation like ourselves or somebody else, and they go to one of these booklets, you know, there's so many organisations in these big booklets. which one is suitable for me? You know, and I think we need to say, look, we need to try and get better guidance, because if I ring the wrong organisation, it doesn't work out for me, you know, will I go into the next organisation? So I just think there's a huge amount of organisations doing a whole lot of good work here, but which is suitable for me in my particular circumstance? I think we need to try and provide guidance to people on that if we can at all.
Yeah. Thanks very much, John, and thanks everybody for their engagement. And I acknowledge the President Eddie Punch here as well, ICSA, and thank the points that were raised earlier. I've got to finish now, but just on the panel, and maybe a minute each, we try and keep it as tight as that as we can. If there's one key takeaway, there's farmers at home here who come in for the tea break and turn this on and are watching it in their kitchen before they go back out to the yard. And if there's one key takeaway you want a farmer to take away from this discussion this morning, what would you like it to be? No?
I'd say farmers have a functional view of health for obvious reasons. They want to be able to do their job, and to understand the hugely important role that physical and mental health plays in maintaining that capacity to function well, and not to wait until things reach a crisis or a threshold of severity before they access support to seek help, but to be proactive, to reach out to supports in the community. We've talked a lot this morning about different initiatives. There's an onus on us as well to try and harness the key findings and key learnings from all those initiatives, and to be there for farmers in a way that we haven't been in the past.
Is Noel Donna?
Yeah, just I suppose if if you recognise something in yourself maybe isn't right, or if you recognise it in someone else, reach out to that person. Or if you recognise in yourself, reach out. There are services available there. So take that first step, but really reach out.
Thanks, David.
I think I'd reflect the point that Francie was making there in terms of it is so important that farmers talk about this to other farmers, because if the view of farmers in general is that we don't talk about this, well, then we won't. So, I mean, if there's a farmer there and they have the capacity and have the language to say, listen, I'm struggling, or whatever way they want to frame it, it is critically important, because that helps change the culture.
Thanks, David. Last word to a farmer, Peter.
To other farmers, don't underestimate the understanding and the progress that the industry is making. And I think the industry should be congratulated for what they have done for mental health in the agricultural sector over the last few years. I just want to actually finish on something that David drew reference to, which is suicide. And I think that shows how much the stigma has been broken down over the last number of years. The fact that someone is willing to honestly mention that on stage here, and I think to a farmer sitting at home, if you are struggling, the industry is willing to have these conversations openly. So yes, there is a phenomenal amount of help out there, and if you are having suicidal thoughts, you should not feel any shame in that there is support and understanding, and at farm level, but at a counselling level too, that those challenges can be overcome.
Yeah, absolutely. Look, thanks very much, everybody. Sorry to the people behind the scenes for having run slightly over, but this has been a really interesting debate and conversation. I'd like to thank our very esteemed panel here for their time and their engagement, for you for those questions, and to say that in about 10 or 15 minutes time, we have an excellent second panel coming up to continue this debate and discussion. But right now we're going to take a quick coffee break. For those at home, we'll be back very shortly in 10-15 minutes. But for now, thank you very much.
Good morning. I suppose just to say at this stage now, this is the second session, and to focus on promoting and supporting farmers' health and well-being. And I'm sure the discussions will be informed by the earlier discussions. So I just now want to hand you over to Biddy O'Neill, National Policy Lead, Health and Wellbeing at the Department of Health, who will chair this afternoon session and introduce the panellists to you. Thank you very much.
Okay, so thank you very much, John. And I suppose just to reiterate what the Minister said earlier, we're delighted to be working with the Department of Agriculture and the HSE on this project. And it's really innovative. And for me, working in this area of health for a long number of years, to get another department to come on board with us and to fund
this work is a really critical step forward, and we're delighted with it, and it's how more initiatives should develop across other departments. So what I'm going to do to start off, as John has introduced me, that I work in the Department of Health and Healthy Ireland, and I've been working in the area of promoting health and wellbeing for over 30 years at this stage. So something I'm still very passionate about, and something that I still feel needs huge more support as we go forward. And I suppose our session now is responding to what was raised this morning and kind of going a little bit deeper into looking at how can we promote and support farmer well-being. So we've heard all the evidence this earlier and some interesting discussion, but how do we go to the next step? So that's what the panel here this morning will be doing. So I'm just going to ask them to introduce themselves, say where they're from, just for a minute each.
Hello everybody, thanks Biddy. My name is Fergal Fox. I work in HSE Health and Wellbeing. I'm the Head of Stakeholder Engagement and Communications, and I lead on the Healthy Ireland Men plan that we deliver in conjunction with a broad range of partners.
Hello everybody, my name is Eddie Mullins. I am the CEO of Merchant Ski Ireland. I formerly worked for the Irish Prison Service, where I was the Governor of Mountjoy Prison. And I suppose you're saying, what's a dub doing here in the Midlands talking to farmers? But like every dub, our roots are obviously in rural Ireland, and I'm very proud to say my roots are in Clonard, just outside Portlaoise here. So it's great to be here, and I hope we can add some value to the conversation.
Hello everybody, my name is Josephine Rigney. I work as a resource officer for suicide prevention. I cover the counties of Laois and Offaly, which is why I'm here today, but there's 21 of me throughout the country representing all of the different counties. And my main role would be working towards Connecting for Life, which is Ireland's national strategy to reduce suicide. And in that, working with all our various partners, delivering training, just creating that level of suicide safety in the country.
Good morning, everyone. My name is John Keane. I'm a dairy and beef farmer from South County Laois, a very short commute this morning. I'm a co-founder and co-lead in a mental health support program called Make the Move, which we've established since 2018 with an aim to help farmers and rural people to deal with their mental health and suicide.
Hi, good morning everyone. My name is Finola Colgan, and I'm a development officer with Mental Health Ireland, covering the area known as CH08, which are Midland counties plus Louth and Meath. And for the last number of years, I've been the national lead on addressing mental health and well-being in relation to the farming community and agriculture and rural in general. And I couldn't but help think when Minister Heydon was talking about women in farming, and that I've a husband for a farmer, or a farmer for a husband, I'm never sure which it is, but I also thought that, you know, Groucho Marx quote, like, I probably might be misquoting it, but anyway, basically he said at some point, behind every great man is his secretary, and behind her is his wife. But I tend to think farmers' wives are both wife and secretary, so we double up there for half the pay.
Yeah, okay.
Yeah.
Okay, so thank you very much. So Fergal, maybe we'll kick off with yourself. And I suppose the discussion this morning talked about a case for focusing on farmer well-being. So currently within your remit, what's on offer?
Well, I suppose I'd like to answer that in two different ways. Like our agenda around Healthy Ireland, we're trying to promote the health and wellbeing across the population. So we're trying to do a lot of programs that are focusing on the likes of healthy eating, improving physical activity. Improving mental wellbeing is a fundamental though. And like we want to focus on things like alcohol and sexual health, all these topics that we focus on, but we find that mental health and wellbeing it's a fundamental, because you can't improve a behavior or change behavior unless you feel good about yourself. So you need a certain level of confidence, you need to feel maybe supported, and all these things were touched on this morning. One of the things we focus on is tobacco. One of our signs up there around quitting smoking, and that's an interesting one for me in relation to men and women, because we offer people a kind of a space, one-to-one counselling around kind of advising people how they give up smoking, and invariably in those conversations loads of other things come up, and particularly when you have men you know, been talking about their health behaviors on a one-to-one basis, it's huge, you know. In the case of farmer wellbeing, I suppose we see that, or it's kind of come into us through under the men's health remit, even though, you know, obviously there's not all farmers aren't men. But we've kind of focused on farmer wellbeing, and in partnership with the Department of Health and the Department of Agriculture, we've been able to kind of make a bit of ground there, and initiatives like Noel mentioned this morning, like Farmers of Hearts, where we do that a health check, but we provide coaching to the farmers by phone. And that again, that you're kind of given a space, or you're able to develop a relationship on a one-to-one basis around men's behaviours. Now that's focused on cardiovascular, but that, you know, the farmer feeling that social support, or feeling that somebody's got their back, or somebody's trying to help them. And invariably, a lot of our, because we're trying to target, you know, everybody in Ireland, not just men, not just farmers, that, you know, we're always trying to develop programs online, and have accessible programs and tools and resources that people can access. And at the moment we have a stress control program. It's a CBT based program, and we're in the process of developing another similar program ourselves. We bought that in, it's a franchise program. And other things that we've an online Minding Your Wellbeing program that speaks about kind of protective factors, and I think that's been touched on a good bit this morning as well, and we'll probably talk about it a bit more, the protective factors that farmers in particular should focus on. The other initiatives that we're involved in doing are I suppose our health promotion and improvement staff deliver engaged training, that we're trying to get everybody to work with men. You know, and we're trying to, I suppose, learn from an event like this to bring that learning into that group of people that are training other agencies on how to target men more effectively and better, basically. So I suppose we're really, you know, we see kind of like our you know, it's very important that we target farmers. We're very important that we support rural Ireland, but like we have a mix of very broad things, and then a few narrow programs that we're working with in partnership with some of the people here.
Yeah, and that engaged training, if I'm correct, was developed in the recognition that a different set of skills or a different approach was needed to engage men. That they were outside the system. Women tended to have more contact with the system. Yeah, it's you know, it's complex.
It is complex, but it's I suppose at a very base level, how I describe it to people is like it's easy, and it's fairly easy to target women, and even on our online program, sometimes, like, you know, we make a great online video and program, you think, but then you look at the statistics of who's watching that, and it's, you know, it's 70-30 sometimes in terms of the gender mix, and you think, how do we target? You know, so we need the extra support to get to the you know, as Noel mentioned, sometimes hard to reach groups. That's why we have to take a narrow focus as well as the broad focus.
Okay, Josephine, maybe I'll just move on to you naturally there. So as the resource officer for suicide prevention, what can people engage who are listening in today? What can they access in terms of support or training?
Yeah, thanks, Biddy. And I suppose, yes, and the two aspects are really what we need to cover. The supports are available and the training is available. Because I think fundamentally, and, you know, I was really struck, and I'm sure everybody was, by the statistics, and particularly that Dr. Dunn mentioned that 70% of people, of farmers, would reach out for help, but that only 25% of them actually do it. You know, they need help with the difference there. And look, we can all acknowledge how difficult it is to reach out for help. How difficult it is to be able to say, look, I'm struggling here, I'm not coping, you know, and that's amplified from a historical and a cultural point of view for a farmer, and for all those elements that we know that make up that. So therefore, I think it's really, really important then that each and every one of us, and I was really struck again by the phrase that Dr. Noel Richardson said this morning about cultivating. Maybe each and every one of us need to cultivate our reach-in skills. How do we reach into people? Reaching out, we've heard that spoken about this morning, and that's really, really important. But how can each and every one of us reach in? Because fundamentally, as individuals, we make up society. We can all play our part to reduce the loss of life through suicide. That's a scary place. How do I open up that conversation? How do I even give myself the skills to be aware that somebody may not be in a good place? What are the things I look out for? Is there an unusual change in their character? Am I seeing an inability to deal with stressful matters that previously might have been there? Am I seeing an emotional and a physical withdrawal? You know, the different things that I'm noticing. And what are those things saying to me? Oh yes, I could be saying, oh gosh, maybe that person's not doing so well. But maybe it should be saying something more to me. Maybe it should be saying to me that they need me to reach in that casual chat over the fence that Mr. Heydon referred to this morning, that maybe that can make a difference. Again, it's opening up that conversation. But then maybe if we're hearing more things in that conversation, I'm not coping very well, it'll be all over. Those things that sometimes we would love to just let go over our head and not take notice of. But maybe I need to take note of those. And what is this saying to me? That's a scary place for me to be in this conversation now. It's even scarier for me to be able to say, gosh, to think maybe I need to ask this person, are they thinking about ending their life? And it's even scarier to hear what is the answer I'm going to hear from that, and how am I going to manage that answer? How am I going to cope? What am I going to say? And that's why I really think that, and we all know how, you know, we all have awareness of physical first aid, CPR, defibrillator, all of that stuff. But what is our level of knowledge around suicide first aid? And and in that, the HSE offers supports in that regard, because we only know what we know at a certain time. Any of us, you know, we can't know how to support somebody when there is a vulnerability to suicide unless we get training in that, unless we build up our confidence around that, unless we build up the reassurance in our own ability. We have that ability to connect with people. We have that ability to be able to, our intuition tells us there's something not right here, but I need something else to be able to help me to reach in and do that. And so we offer online training. There's a training called Living Work Start, and it's available all over the country. The National Office for Suicide Prevention have a website, www.nosp.ie. They will signpost to all the training that is available throughout the country. We also offer Safe Talk training, which is suicide alertness for everyone. That's face-to-face, and Assist, which is a 2-day training. And that's really, so we offer that, and it's free all over the country, not just in Laois and Offaly, but every resource officer around the country is offering that. And part of that is, so it's now I know what I can do, but where do I signpost people to? And there are all the different supports. Some of it was mentioned this morning: Samaritans, Pieta, yourmentalhealth.ie, yourmentalhealth.ie, which is a brilliant website that the HSE have, which includes information on every aspect of mental health that we might want to know, what queries or what information I want to know, but also where are the supports in Cork, Kerry, Dublin, wherever they are. And that's one way I think we can provide that support to everybody.
Great. Okay, so we very clear supports available, plenty information about them and all of that. So I suppose the difficult step, maybe I go to you, Eddie, in terms of people, you know, you've worked with a lot of different vulnerable population groups, you know, people who end up in the prison or in the Merchants Quay have their challenges. So what is it? So like what I'm kind of thinking is, how do you get those to engage? Or have you any learnings from your experience in terms of how to engage the vulnerable?
Sure. Well, it is a really good question, and I was really taken back by the video and George's story. And you know, he stressed throughout the video the importance of reaching out to somebody. And I can think of a particular event a number of years ago where a farmer contacted me. We had no connection, and he was going through a really difficult time. One of his children was engaged in drug taking, and the son had amassed a fairly significant drug debt, and the drug dealers were looking for their money. And they came into his farm yard and told him that either pay up or we're taking your tractor. And for me, obviously, without a farming background, I can't imagine a farmer being able to farm without a tractor. So he was in a really bad place. Family were very distressed. And I think one of the most significant challenges for him was he didn't want anybody in the community to know about this. So he was trying to manage the situation without any support because he didn't know who to turn to. He eventually dealt with the Gardaí and resolved the issue. I won't go into the details of how he resolved the issue, but he did text me there recently, this is a couple of years ago, and he texted me recently to say that, just to say thank you for the support, because it was a very difficult time for him. And I think, you know, we look across at now, my new role in Merchants Quay is very much around addiction and, you know, and homelessness, particularly in Dublin. And Merchants Quay, for those of you who don't know, it's a national charity, a homeless and drug treatment charity. We are based here in Laois Offaly, we're based here in Cavan Monaghan, the southeast, and of course in Dublin. So we have a wide level of service across primarily Leinster and Cavan and Monaghan. But one of the strong indicators from rural Ireland is our people are reluctant to come forward, and there is a sense of well, we'll keep it within the house and we'll keep it within the family, and we won't seek support. And mental health, unfortunately, one of the side issues of mental health is addiction. So people look for comfort in substance abuse or maybe alcohol to try and deal with the mental health issues. So it is really important, and I think the team across the conversation this morning has been about, you know, reaching out and making that first step and not being afraid to do so. And I can certainly speak from my own perspective in Merchants Quay and other agencies that I've dealt with, that people are very empathetic and very sympathetic to a person's plight, and people will be dealt with where they are at without any judgment. So never feel in any way inhibited or reluctant to seek support, because it is there and it's plentiful. There are lots of organisations across the country like Merchants Quay who are there to support families during difficult periods. So I would encourage everybody, as everybody has done this morning, to take the opportunity. You know, you're not alone. You don't have to deal with this challenge on your own. And again, you know, alcohol, we talk about Merchants Quay, primarily people look at it and they look at drug treatment and they look at drug abuse, but alcohol is certainly one of the biggest issues across both urban and rural settings in terms of addiction. So just to be mindful of that, we also provide a service in that respect.
Yeah, and really behind every addiction, there are a lot of issues. Do you know, addiction is the front very often, and as you said, the alcohol is used to mask
it. And of course, the reality is, from, you know, the person who has the addiction, obviously that has an enormous impact on the family and the community as well. So it's not just that person, the family are going through that addiction with them as well.
Yeah, I was struck by, I can't remember who said it this morning, but they talked about in the farming community, there's a culture of self-reliance. And growing up in rural Ireland many years ago, it was very much like everything was kept within the house. You know, the topic of conversation was, what would the neighbours say? You know, and that was ingrained in us, you know, as children. It was that's how we were all brought up in rural Ireland in the 60s and 70s, I'm sure, and nobody's no different to me. So it's really hard then for next generations to break that and to change those patterns, because we do ingrain them and we do absorb them. So it is difficult. So Fionnuala, maybe go to yourself now in terms of just building on that, in terms of your own experience around bringing farmers forward to engage in their well-being, mental well-being.
Yeah, well, my experience obviously comes from the dimension that I married into a farm. I will have been reared from, my father would have been reared on a farm in west of Ireland and left that. And so I suppose that kind of land thing is in you somewhere along the line. And I was the one that ended up marrying a farmer. And it was a whole new way of life. And I think communities and people don't understand. And I saw it within my own family. They'd come and they'd be visitors. Are you lonely here because there was no houses around me or whatever? And so, like, while it would appear there's a lot of isolation and loneliness, farmers and farm families and they do support each other. And I think that's very important to like to see the positives in that. And that I know personally, I believe that the biggest barrier to getting and sourcing the help is the attitude and the language around mental health and what it represents. And of course, a lot of people think of mental health as mental illness, and then people don't want to be, oh, I'm mad, you know, but we're working hard on changing that literacy. So it's about supporting, I think, and this is the strength of programs like, you know, developed by Noel and Men Engage, and I've done the training. It's also about On Firm Ground, it's also about Farm Connect, it's also about what Sinead has done. It's also what we've done as an organisation. We've gone out there, we've consulted and co-produced. And one of the packages we find works really well is the concept of 5 ways to wellbeing: to connect, be active, take notice, keep learning, and to give. And I remember when I was chatting to my son, he said, "Mary, what are you talking about telling a farmer be active? What else are they but active?" But I said, look, no, Niall, they need to be active off the farm and to get out there. And it's about encouraging and giving them positive. But I also think we need to be very positive as well, that not all farmers are struggling. And if they are struggling, then yes, they need to get help. But there could be that in-between phase, I think, of where, and I suppose that's where it may come into a struggle, and it brings me back to a stitch in time saves 9. So that's why it's so important to have all this information out there before it gets worse, to do something about that. And that's the strength of the partnerships.
Fergal, you just want to respond?
No, I just to echo your point around health literacy. And just to follow up what Josephine said around yourmentalhealth.ie, we often encourage everybody to go onto your mental health study, no matter where you are at this moment in time. But one of their literacy focus this year is, look at sleep, look at your anxiety, look at stress, look at low mood, and get a good understanding. And there's been so much work put into the background of that website to make the language super accessible.
Yeah.
But like, it never hurts to peruse that website. We have an ongoing series of webinars around men's health, and we've often taken a focus on farmer health and had voices from some of the stakeholders here. But that website, I think, is just so valuable to people, when you're not in need. And Josephine spoke about reaching in and reaching out, but having that kind of frame of reference, having the language, that Josephine also mentioned, the confidence to be able to have these conversations. And that's literally what we're trying to do with On Firm Ground, being able to flood the farm and workplace with the ability to have wellbeing conversations. I mean, it's fantastic if we can do it. But and this event in itself is promoting the exact same culture change. And don't be under any illusions. We are trying to promote a culture change. And one of the other damaging cultures that I would have experienced is this not award, but kind of recognition of overwork in the farmer community from my own personal experience. It's like, as hard as you can work, you're a mighty man. Isn't he mighty? And this kind of 8 to 11 clock, and it's just like, that's when you get award. And when you're kind of growing up in that, you think it's kind of hard to unlearn that, or you have to kind of consciously say, that's actually damaging. You need your, as you said, Finola, you need your out, you need your protective factor.
I think families can play a big part in that, where the male, the father, is doing a lot of the work, the family can tone that down. But I also think too that, and I've seen this again from lived experience, as they say at home, the amount of people that will come through your kitchen and the chat. And I remember coming home from work one day and my husband said to me, he said, "Have I got counsellor written on my forehead?" And I said, "Why is that, Tim?" And he says, "I don't like," and they're all tough stories, they're all sad stories that, difficult situations, family members and that. But sometimes, like, well, my husband isn't a counsellor, but absolutely not, but it's just about the listening. And that's the big part of it, isn't it? And I think we should give farmers credit that they do internally communicate with each other as well, and that mightn't be measured, or I don't know, is it measurable or not, David, but to establish that point.
It's a new piece of research for you, David.
Yeah.
So maybe, John, it's timely to turn to yourself now as a young farmer, and like maybe just kind of what your sense is in terms of what you need, as a young farmer in society in Ireland in these 20s.
Yes, so I suppose my experience is informed by being a full-time farmer and being involved in the mental health support charity, but also through some work that I did with MOCRA. And the predominant theme coming back from young farmers is that the conversation around mind fitness is what they like to speak about. Moves from response to regular. So when we talk about the rest of our health, it's a regular conversation. So we talk about, breaking an arm and playing sport, or we talk about some physical impairment. It's a regular conversation. Whereas when we talk about mind fitness, it's a response. It's a response to something. It's, that person has depression, is suffering from anxiety. It's a response to something that's happening in that person's life. Physical fitness is something that we look at on an ongoing basis. So to keep fit, I'm involved with my GA club. It's a constant fitness to get to a certain level. Your mental fitness is not something that, your mind fitness, it's not something that we check in. I'm not sure we do it as a society, to be perfectly honest about it, but we definitely don't have those conversations as farmers, and we definitely don't have them at home around our kitchen. So that mind fitness is a very important piece. The pressures that farmers face and young farmers face are very different at different stages of life. Just talking to Norma there from Embrace Farm at the break, I'm 32 years of age. We welcomed our first baby girl at home 8 weeks ago. That's a new pressure for us at home. We're also in the process of doing a mortgage. We have capital investment at home on the farm as well. In 10 years' time, those pressures will be different. From speaking with Norma there, they have an elderly relative that they're now starting to mind. They have the whole issue of succession and inheritance. You move that 10 years further down, you move from the person who's inheriting the farm to the person who is going to be transferring the farm over to somebody younger. Just to say that the challenges that face farmers are the same at different stages is just not what we find. And a piece of research that we did with Make the Move a number of years ago, we met with 400 farmers in Tipperary and 150 farmers in Roscommon. And the language is the single biggest thing that they brought back to us that reinforces the stigma. Farmers themselves talking to one another, but also ourselves who are working with them, reinforcing the stigma by language that we don't even think we're using. I was met with a discussion group in Kerry during the week, and they spoke about looking after themselves. And a farmer stood up and spoke. He said about, you know, I vaccinate my animals for IBR, for lepto, for salmonella every year. My vaccination for my Mind Fitness is not the term he used now, but I'll use it today. My vaccination for Mind Fitness is going to my discussion group every month. And the next farmer spoke about, well, my vaccination, for want of a better word, is going to my GA club. Another farmer, he enjoyed making furniture. So it's about the language that we use that's relatable to farmers, that doesn't alienate them. And just a final point to just pick up from the earlier conversations. I know Francie spoke about it and Sean spoke about it. It's not to have a go at anybody in particular. It's about how we deal with those around us. And they mentioned about departments and payments, and I'm not speaking any specifics here, but it's about the association that farmers have with the organisations and the businesses that they interact with. So Peter, for example, had an association with the Department of Agriculture that's very positive. So in a time where there's a challenge, he has had a positive historic association, so he's likely to reach back out. Farmers who've had a negative association with whatever organisation, association, government department it may be, at a time of crisis, they're not going to reach out because their historical association has not been positive. So for the minister listening or any people of influence, it's about building on that power of association so that when times of pressure do come in, that they can reach back into it. And then just the final thing that came from, we did a piece of work with our ag colleges last year, and Francie mentioned that we did a pilot program in 6 ag colleges around training. It was a 6-hour program that we did with 150 students, training them around Mind Fitness and how to prepare for later on in life. And it was really, really well received by the students, and it was a pilot program, and hopefully funding might come in the future for it. But one of the students made the point that, you know, when the Titanic hit the iceberg and it started taking on water, it was too late. They needed to be addressing that in the shipyards in Belfast. So we have to start, as Francie said, in the schools. I firmly believe in the ag colleges, we need that specific tailored training to deal with the challenges that come with farming because they are very different.
Yeah, and I suppose from a health promotion perspective and a well-being perspective, we see it as a life course issue, you know, that we start from a very young age and you build up the resources all the way along. And I think it's really important as well, because we've talked about like what farmers need when they're in crisis very clearly, but then there is that piece of having, and for all of us, what skills do I have that support me when I hit the crisis? So not waiting until I hit the Titanic hits the iceberg. So in that space, Fergal, is there other areas or is there other aspects that we need to develop or enhance? I mean, somebody mentioned earlier as well in relation to having the right services and how, you know, when somebody goes to pick up the phone or makes that call, and if they don't get and they don't feel they're understood, you can just lose them for another 6 months.
Yeah, that's definitely the worst case scenario.
Yeah.
Just to pick up the piece on the schools, you know, and it's another very strong piece of our interdepartmental work, and is with the Department of Education and the HSE and our health and wellbeing colleagues, trying to work with teachers so that we have mental wellbeing programs and, you know, been able to, I suppose, get the health literacy in at preschool, primary school, secondary school. You know, you see the department and the Health Higher Education Authority now doing way more work on Healthy Campus, so there is, the Healthy Ireland movement is trying to, I suppose, fertilise the kind of vaccination program, if you like, for mental well-being, to kind of give inoculation at regular intervals through the education system. But we're always looking to reach down, I suppose, to the, like as Noel said, the hard to reach, or the people that aren't getting or may need more support. But going back to your point around, you know, accessing, or, you know, anybody that's patient-facing, as we call them in the health service, or public-facing, needs, I suppose, needs to have that bit of cop on, you know, and that training that, you know, we offer it in terms of the engaged training in the health service. We offer what we call making every contact count training, that if you get somebody in front of you that you can ask them about their smoke and their weight, their mental well-being, that's a component of what we're trying to do. So that any opportunity you get to have that conversation, especially if you're a trusted health professional, we think that's a very valued relationship. And in the same, I suppose, in the department, the people, you know, they acknowledged earlier on that you have an interaction, you have to make the most of it. And somebody was talking to me last night about the, one of my colleagues, she works in mental health, but she rang somebody about her driver's license, and her son has a kind of physical impairment, and she was trying to sort out the license or something, but they wouldn't talk to her because he was over 18 or something like that, and she got so frustrated and she got upset emotionally because he just got, you know, he got a certificate he didn't think he'd be able to drive, you know, and all this came up in her, and she was getting angry with the person on the phone, and she said whatever the person was trained in kicked into place, and she just kind of talked me down. She listened to me, and all of a sudden I could hear I had kind of overstretched. Do you know what I mean? She got upset. She's usually the person talking about how to engage with people, but she got, you know, she was upset, and she told this story that she didn't need to tell about her son, but she said the person on the other end of the line was just so accommodating, and she listened to her, and she said, okay, we'll have to go here and there. But the essence of the story was, you know, whatever she was trying to get at, or she was telling us the story, that that person was trained to listen, and whatever emotional wavelength you're ringing in on, and if you're making a phone call about somebody belonging to you or your own care, you know, you're carrying a certain bit of mental baggage there about something, or you're feeling vulnerable, or she was very, very, very emotionally attached to her son's vulnerability, and you're kind of exposing that. So when you're on the end of the phone, you know, you have to be, I suppose that's a generalization that we have to kind of bring to all our public services. So I definitely, you know, think that the message that was highlighted earlier on about, you know, the department phone call or not being able to get through, you know, and things like that is massive frustration. And that certainly we can bring to the agribusiness sector and across, you know, not just from a public service point of view.
I sometimes think though, like, and I'm listening very closely, and there was a very interesting project done down in Healthy Ireland, Clare, where they brought out, you know, one of those graphic artists that, and they visited all the what you call it, the marts, and they had focus groups discussions, and they based it on what farming past, present, and future. And it's amazing what came out from 6 or 7. Like, you know, the guys that, and I don't know what the age profile was, but you know, they were saying they love their farming, they love the access to fresh food, the milking, like it's just unreal. And so it's just everything has changed so much for them, and it's about kind of recognizing that. So if it's a financial worry, if it's you know, a mental health issue, if it's whatever, we have to be very careful what we are saying and advising farmers what will help you. And sometimes, like, to maybe say to a farmer, like, join a GA club or go for a jog or whatever, that might be the last thing that'll be on his mind. So I think we have to have a range of opportunities and get them building on their own natural resilience. Because like all those, what you're talking about, is like, they're amazing resources, but it's getting the farmer, as we're focusing on, how do you get them to engage with that in the interim? And that, you know, it's an opening, it's getting the conversation going. So it's recognizing where they're at.
You know, I'm just thinking of the conversation, and I suppose the elephant in the room for me in terms of the role I'm in now is drug use. And you know, the estimates of the value of the drugs trade is about $500 million a year, and growing. And for such a large business, the reality is that drug use it's across every aspect of society. It's not just urban based, it's very much rural based now as well. And it destroys families and it destroys communities. And I think very often we're not prepared to have that conversation. So we have a stereotypical view of a drug user, and we don't see it as, you know, we don't see it in our families, in our communities. We don't see those people as the people who are engaging with drug use and also supporting criminal behavior as a result of it. So I think it's very important that when we're having conversations, honest conversations about mental health issues and issues across society and in the farming community, we have to look and talk about drug use as well, because it is a significant problem and it leads to further issues. It leads to mental health issues, further mental health issues, and very often, you know, because of drug debt, as I mentioned earlier, people lose farms and things over this, and businesses over drug drug taking and drug behavior. So when we're having those conversations, we need to also realize that among the farmer community, there is a problem around drug taking as well as any other section of society.
John, can I just ask you, so in terms of, they talked a bit this morning about the culture and the culture that you push yourself and you work, you know, all the hours that give you, and yes, that was, I think, ingrained in all of us growing up. Are young farmers changing that? Are they saying, it's okay, I'm taking holidays, I'm going away? You know, is that culture changing of pushing and pushing and pushing?
I think that culture is slowly starting to change. I see it myself in discussion groups and different groups I've been involved with, that there is now more of an acceptance among our age group that, okay, it's fine to, as Minister said earlier on about Kevin Moore and farming in the west of Ireland, to start at 6 o'clock in the morning and be finished at 5:30 or 6 o'clock in the evening. I mean, at home, if we're not finished before 5 o'clock, it's considered to be a late evening. So that's a very general accepted rule among the younger populations of farmers. But there still is I suppose, that pride that's there among older farmers as well, to be working all the hours of daylight or all the hours that you're given, and if you're not a good farmer. I think the realization is there now amongst younger farmers in particular that there is an opportunity there to have a better quality of lifestyle, but that is afforded by having an economic return from the farm that allows you to do that. So we see, you know, in smaller, more vulnerable sectors in farming, that because there is that not same economic reward, the same opportunity is not there to bring in the relief that allows you to take the time off, that allows you to go to the GA matches, that allows you to have, you know, to go on holidays. So within all of those things, there is a variable number of issues affecting it. And I would just say we spoke this morning and here as well about the different challenges that come to farmers and change and so forth. And Fionnuala mentioned it as well there about, you know, that we have to be careful the advice we give to farmers. A farmer I met recently described the challenges and change coming at him, a sheep coming through a gap. You know, they don't come in ones, they come as a big flock. So all of the challenges tend to come in groups, as we all know in general life as well. So it's about, yes, your vet might be specialised in a particular area around disease control, your financial manager, your co-op manager is about this particular issue, but you need a holistic approach sometimes to, and that's where your advisor and the on-farm ground programme will play an important role as well, that one individual issue can often be compounded by, you know, several other issues. And I see it ourselves in different people that we've dealt with in Mockra and Make the Move and myself personally, that when one big challenge comes on, reacting that to make an impulsive decision may not be the right decision despite the advice for that particular issue, and it can compound further down.
Yeah, and I suppose that's the same for all of us, you know, that we can cope with a certain amount of challenges. When a whole lot of them come together, then we're really tested. So at this point, I'd just like to open it up to the floor if there's any questions, and then we can come back to the panel again. Yes, down there.
Yes, George Graham here. Chair, panel, ladies and gentlemen, I might be repeating myself on a few things I mentioned earlier, but a couple of things for all this to work, and I think this great work has been done because it started in the right place, the right people involved, and I think it certainly is going to work. But it has to work from every aspect for it to work. And I'm just going to make one simple point on that. In farming, there is a lot of people involved. People that, and it was mentioned earlier on in a slightly different way, there's people that come into a yard, but I know, and I know that greed can be a big issue in modern day world we're in, which is a massive problem. But there's people such as salesmen come into a yard now. I know they have been told they want to make a sale, they want to make money, but they've equally been told under no conditions do you go into that house if you're asked to have a cup of tea. Remember, one of the greatest medications, one of the greatest things we ever can get is a cup of tea. When we all went out earlier on for our coffee or tea break, what did everybody do? They chatted. You can never know or underestimate the person that's asked you in for that cup of tea. It mightn't be just a cup of tea. You don't know what they want to talk about to you. And it's so important. It's the same, for instance, and I've done some work with the banks, and I've been at the wrong side of them all my life, so I know what that's like. But equally, you ring up and you can't get anybody to talk to you. That does not do anything for you if you're not in a good place. And even if you are in a good place, it can often pull you down. So that is really, really, really important. And the language we use, but little things like that is so important. So it has to work with everybody. For instance, farmers as well, I think we are a little bit inclined to undersell ourselves. Where if we're a farmer, we are a farmer and we're professional in what we do. You could have a manager of a multi-million-euro business and ask him to come down and run your farm. Could he do it? Probably can't. Or can the farmer go up and do these? So we shouldn't undersell ourselves as farmers either. We are professional, and of course, it's well known that we're doing the most important thing involved, producing food to keep us all there. So that's equally important. Just that's one point. But again, I would like to compliment the panel. I think it's absolutely brilliant. I think we've started in the right place. And my belief is that it's certainly going to work and is working. So thank you very much.
Thank you. Thank you. This gentleman here.
Thanks very much. My name's James Claffey. I'm Deputy CEO of Irish Eurolink. I'm also Project Manager of CAP Network Ireland. I suppose, and thanks to the panel for all their comments throughout today as well. I was just thinking there as well, I'm coming at this from a different point of view. We did a couple of workshops recently on the knowledge transfer program with farm advisors, and we hear it all the time. The biggest concern to advisory service and farmers is actually succession. And it's such a worry, who's going to be the next generation taking over the farm? But are we doing ourselves a disservice by not promoting more actively the positive impact of living on a farm, growing up on a farm, and becoming a farmer? I think we're probably selling ourselves short. I'll give you a short story. We were lambing last February, and there was a ewe having difficulty in lambing. I was pulling the lamb, but I could feel my phone vibrating in my pocket. And all I came was, geez, I'd love to stay here all day with the sheep and actually work on the farm rather than going to deal with what was going on my phone for work. So, you know, there is positives there, and we were involved in the Farmers for Safety EIP project, and Donald Sheehan in the Bride project is a big advocate for that. How can he expect his kids maybe to take on the farm when he retires if he's actually selling it down? And I think we need to be mindful, I suppose, of that as well. And just going back to the Farmers for Safety, we had 6 farm mentors, farm champions. One of them here today is Mary Oakley, and I think we need to rely on farmers to communicate with each other as well more. If we have these people in place, they will be there, they will communicate with them, and they'll be there forever. That project was reinvented from something that was done back in 2013, and the champions in 2013 are still very active. So farmers have an interest in it, and they will talk to each other if they're encouraged to do so. Just 2 very quick points.
John, sorry, John, do you want to respond to that?
Yeah,
Fionnuala, you can come in there.
There's probably 2 points I was going to say to, and thanks James for raising that the succession piece is probably the single biggest challenge for, I'd say, both ends of the spectrum, to be perfectly honest, the young person coming forward and also the older person stepping back. And I think there's a huge role there for department officials and for various different organisations involved in that succession piece, because there's huge financial worries that affect both generations and financial security in there as well. But we're in a situation now where there's less than 6% of the active farming population are under the age of 35. That's 1 in 16. You know, I often use the analogy that you'd fill a GAA team 1 to 15 of people over the age of 35 in farming before you'd have someone as under the age of 35. And I think the farm champions, and I've met some of them over the years as well, that voice of farmer to farmer is probably the most powerful piece that you can have, and the ambassadors like George and like Peter and many others is probably the most effective way of getting that message to communicate across to farmers. But it's moving from the response piece to the regular piece that I think is the crucial piece for getting that message across.
Yeah, a few years back, James, the Skibbereen Credit Union did a survey, interesting enough, with the wives of their farmer members to establish their levels of stress, and then they ran a conference around it. But what was really interesting was lots of stress is form filling, everything we're recognizing, but 95% of the 200 respondents said they would not change their way of life. And this is what we've got to appreciate, because there's a lot of positives, and we probably see it more in our rural towns and villages, and you know, kids going to school, you know, like I often look at my own children and I compare them to their cousins living in the cities, and I often think my kids probably have me up for abuse anyway, but you know, cheap farm labour as such going up, but it enhances their skills. We need to look at the qualities as well, and around that. So I think it's a good point made, James.
Okay, yeah.
Hi, I'm Teresa Road here from IFA Farm Family, and just in relation to farm succession and inheritance, I just want to brief on that. And We did hold a conference in the last 12 months where it was in, over 2,000 farmers did attend, hugely successful. But again, just to highlight across the country where, again, the stresses of financial, the succession, the big round table needs to be an open discussion, a frank open discussion on farm inheritance. We do need, there's been a massive issue in relation to getting, you know, we need support and financial support. We need support in getting a retirement scheme in place for the next generation of farmers to be able to take over as a younger farmer coming forward. But for the farmer to, as we talked about, a retired farmer, but there isn't anything in place for someone else to be able to succeed them, but also making the will, and then in relation to a successor to be in place. But there's lots to be done and more support needed just for the future of the next generation. Thank you.
Thank you. So there's one other there.
Hugh Farrell, I should say. Thanks to the panel there. A lot of great speaks and sayings there. Or if we could put it all together and they'd work together, it'd be a big thing to achieve. And I think that's where the big problem is, and I think we're looking here where there is the problems on farms and maybe outside it or the students or different issues. In a lot of cases, they're in a state of mind that they're not fit. They need that help and they need that support. But as families, people are blocked from the system. They don't know what's going on due to data protection. And that there often is a big downfall in maybe dealing with issues and getting them sorted in time, because it's too late when it's discovered. But that could be realised through the help of other sources that have identified it. Where data should be allowed within a member of the family that they trust to deal with. And I think that's something that needs to be opened up. Furthermore, there, Eddie, you talked about addictions there and that, and alcohol and drugs and everything. I know in past through hospitals in my time, I've seen an awful lot of people coming in and out through with addictions of all types. And you'd often meet the same clients in the next month or whatever it is back in. And I'd say the HSE needs to do something on this and actually to remove the service from the hospitals or looking after these the facilitators, but moved to outside units and taken out of the hospitals as if they had no purpose. And that was the reason it was given at the time. And I think that's what needs to be readdressed. That brought back there. But it's taken up a lot of our hospital beds. The whole year round, it should be a separate thing, separate unit, because there's an awful lot in there could be referred on to Coolwood or whatever it may be for support. But they have to be dry or off drugs for a week. That won't happen once they go outside that door. There's no link there to communicate or bridge that. Another thing is after our services, 5 o'clock in the evening or weekends. Families are on their own, people are on their own. There's a lot of bridging there to be done. We can talk about it and address it how we like. But unless we join the links in the chain, we're not going too far. Thanks.
Okay. So one final question and then we have to close. Yeah, sorry.
Maybe just an observation, and it was actually George that reminded me of this through something he said about a cup of tea, but I think we need to include rural veterinary surgeons in this conversation from the aspect they face the exact same challenges that farmers do, you know, be it increased regulation, but also finding it harder to get staff and working longer hours. And, you know, you see vets, you know, both here and abroad during calving season, you know, they face burnout, and very often we forget that. But I've spoken to and worked with a lot of vets, you know, outside of Ireland that work with large animals, and, you know, they're in the exact same position that rural Ireland and rural farmers are. And just going back to what George said about the cup of tea, that, you know, the vet doesn't have time to come in and have the cup of tea anymore, but maybe we should be more mindful to bring the cup of tea out to the yard and realise that, look, you haven't 20 minutes to come into the house, but take 5 minutes. And, you know, it's very often that interaction, you know, maybe late at night when a cow needs a cesarean or something, that, you know, is changing the farmer's day, but likewise changing the veterinary surgeon's day. So I think maybe by including the two together, it would we could tackle a lot of challenges together.
Okay, thank you. And I'm sorry, I know there's a few more questions, but I'm just going to take one from online because I'm conscious that people listening in.
How do farmers work on identifying and building positive friendships and relationships to increase their resilience in advance of mental challenges?
And if you want to.
Well, I suppose that's definitely one of the messages. How does anybody do that? There was so many different things mentioned today that men can engage with, and what we call them in our line of business is protective factors. You know, if you have something like self-care is a word, you know, it's becoming more popular now, but like, what's self-care mean to you? Where do you find joy? Where do you find a deep engagement? Where can you lose yourself? Like, some people might somebody mentioned carpentry. Like, I would encourage men, farmers, anybody to find a hobby, you know, and something of interest, and you will find people that are interested in that. All of a sudden you're having a conversation, and that's sometimes those conversations that would happen. You know, people mention GA, when you're at the side of a pitch, all of a sudden you're talking about something, but you didn't plan to come and have a 10-minute chat. So find something of interest and find somebody else that has that interest. That would be the simple advice I give to anybody around that. But those protective factors can be huge for you in your day-to-day, week-to-week, for anybody, especially farmers who are kind of working, could be working on their own for a long period of time, need somebody else to bounce things off or even have a chat, but nothing to do with the industry at all.
Okay, so look, we could keep chatting as the earlier panel, we could keep discussing this issue, but I'm just going to go around now, and maybe Fionnuala, you'll start with kind of a key.
Yeah, I thought we were going to leave the best wine till the end. But
a key message for you.
I'll uncork it. Well, one of the key messages, and any of the organisations we've worked with, invariably have adapted it, and we're also looking at it in the program with the Erasmus Plus project that's based in Europe, farmer assistant resources for mental resilience. So it's connect, which is what we're all talking about. Let it be with your hobby, let it be with the chat in the kitchen, be active, and it's about being active for yourself, and to just take notice of how you yourself are feeling, and maybe those around you, to keep learning. A day like today is about learning, but also, like, farmers have to keep up to date with rules and regulations, and I know it kind of can be very challenging, but you can learn other things, local AINTIS, local library, and then to give. Like, the important thing about to give is not to give to others. Of course, that's important, but to give to yourself and to realize that's not selfish. And, you know, at the end of the day, you can say, I've connected, I've been active, I've taken notice, I've learned something new. And you know what, I looked after myself in whatever the best spirit Fergal was talking about. I think that's my key message.
Thanks, Fionnuala.
Okay,
John?
Just three or four messages, I suppose, from a young farming point of view, the whole realization of the different stressors that are on farmers, and for farmers to realize that other farmers are well aware of those different stresses at different stages in life. For ourselves as a sector to realize that I think the conversation, in my own opinion, should move from the response to the regular. I think that's a hugely important piece for us to do. The language, to be ensured that we're not reinforcing the stigma that's out there around mental health, and talk about mind fitness for farmers and people in general. And then just to respond to that question that came online, from seeing younger farmers and even older farmers as well, building habits tends to be a very important way to build. Farmers don't particularly like the word resilience, but to build strength within themselves is building habits that they can fall back on in times of pressure.
I like that one.
Thanks. I just a few things I just want to pick up on. I mean, I spoke before about that reaching in, but I think really not to dismiss the value of listening, and it's been mentioned a few times, but the listening and how much value that gives to somebody. You know, with 2 ears, with 1 mouth, just to listen in that proportion, and in that, not to be giving advice. How can I help you to deal with your problem? So it's not to take that; it's the empowering piece, not to dismiss the person's own ability to be able to help themselves, but they might need support around that. And also just and the self-care piece as well. It's you know, we've all heard the analogy of the cup. You know, when there's nothing in the cup, it overflows, and we've nothing left for ourselves. So it's to keep building that little cup, and you're putting our own little self-care pieces into the cup so that we always have something to give to others. And then the final thing is that there are services out there. Sometimes we think that, you know, and it was one of the points this morning, the accessibility of services. Yes, there can be a problem with after hours, but, you know, they're always to know that there are services there, whether they're the GP, the after hours GP, the emergency department, where a full biopsychosocial assessment can be done, whether it's Samaritans, whether it's the Pieta, the local community counselling services. There are services there. Know what services are in your area, it enables you then to be able to signpost somebody that you may be concerned about, or even if you're concerned yourself.
Yeah.
If you know where to go, it makes it easier to go there.
Yeah, I suppose 2 points I'd make. Farmers are not immune to drug-related intimidation. I gave you the story earlier, and there are people out there. Reach out to a trusted person, a GP, the vet, whoever it might be, somebody who you trust, and don't suffer that alone. And also, I suppose, on a positive note, to say that, you know, I talked about Merchants Quay, and we see people at whatever stage in life they're at in addiction. But we have 2 residential facilities, and I do agree with you in relation to detox. We don't have enough detox beds in the country, and that's a big issue for people who are at a particularly difficult stage in drug use. But we have 2 residential centres in Ireland, one in Tullow and one in Drumcondra. And when you see people who have come through recovery and are on a recovery journey, and you see how life dramatically improves when they start to deal with the issue, and so there's a positive outcome for people. So don't suffer alone. You know, if you are or a family member is struggling with addiction, there are services there like MQI and other organisations. You will get them, just Google mqi.ie and you'll find a signpost to our services. But the outcome and the future can be bright if people make that call, as George said earlier, and take that first step. That's the key piece in dealing with this issue, in particular in relation to addiction.
Okay, Fergal.
Just 2 things. The first word I'd like to pick up from what the Minister said about his investment in this work and his engagement in the work. And you saw him this morning, you know, chairing the session. That itself is very, very unusual to see. And it's so great to have a minister not just show leadership, but you know, to be so engaged with the topic of, you know, health and safety and health and well-being. It's fantastic to see. But he used the word his legacy. You know, he wants this to continue. And you know, that's a great ask. As somebody on our own International Men's Day webinar the other day said, you know, that's advice that he gives to men and fathers around their legacy. You know, spend time with your child in the first 1,000 days. But you know, the talk about succession and, you know, inheritance and all that, I think that line about legacy is even more important for farmers in terms of their own health and well-being. You know, you want to reduce the amount of disability you have in your life, or the illness years that you're going to have to live with something, you know, by prioritizing your self-care and your health and well-being. Your legacy is yourself, you know, to live as long as possible, in a healthy way. So that's one of the points I'd like to make. And then the second one is just to repeat, I suppose, the culture change that we're all a part of by participating today. I know you kind of got hurt, maybe sick of hearing people saying it's great to be here today, but it is great to be here today. And this isn't obviously day one. There's so much work going on. You've heard so much examples of deep research and extensive projects that have engaged both farmers and the industry and so many stakeholders. So this is a continuation of work that's happening, that so many in the audience here have participated in and taken a leadership role in. So I suppose I just want to acknowledge that culture change is ongoing. It's definitely ongoing in relation to mental health. It's a lot easier to have conversations around mental health in Ireland today, but we need to normalise that with all the populations and all the groups that we want to get to. So I'd like to, you know, to continue that with you all.
Okay, so thank you all very much. And I think it's important as well to say that nationally and from a Department of Health perspective, that mental health and well-being is a priority, and we're currently developing a national mental health promotion plan. And policy is important, and sometimes it can be a bit cumbersome, but unless you have policy gives you the mandate then to actually deliver. And promoting mental well-being is one of our top priorities, and it is as important as physical well-being. And we would have always, all of us who train in health promotion, talk about health in a holistic way, but we can sometimes be just pulled down the alcohol or the tobacco route or whatever, and really you can't separate a person out, you know, that we're one being, and everything that happens to me physically affects my mental well-being, and equally the other way around. So there is a strong focus on that, and it is a priority for the next number of years in the department. So it's like, for me, it's been a great day. I've learned so much from earlier as well. I mean, there's so much going on. There's so much really good partnerships and initiatives, and it is amazing what we can achieve when we come into the room together and when we work together. And we continue to build, I suppose, on the partnerships we have. So men's health is an area that I'm passionate about, as well as mental health. So we've worked as Noel mentioned earlier, we've been working for years in terms of, you know, addressing the needs of men in relation to their health. So thank you all very much, and thank you audience, and thank you online, and I hope that this conversation will continue well into the future, which I've no doubt it will. So thank you all. Here I am.
I'll just say, sorry, you can just remain seated there just for the final portion of the conference. Biddy, just thank you very much yourself for chairing the session, and to the panelists there, Fergal, Eddie, Josephine, John and Fanula. I suppose also to thank yourselves for engaging with the panel and posing questions and discussions. It has been very informative. I think everyone will agree today. Just finally now, I'd like to invite Bill Callan, Chief Inspector in the Department of Agriculture, just to address you now at the closing of the conference at this stage. And thank you very much.
Great. Thanks, everybody. And in many ways, I feel inadequate in terms of standing before you and trying to summarize a few of the points that we heard today, because I think it was such a good conversation. And many of the things I think everybody has to reflect on their participation today and consider, well, look at what are the key messages that they want to bring home. But I suppose to corral that into a few thoughts, in particular, as I reflected on the day, just from a Department of Agriculture point of view, it's not, this is one of the most important events that we're holding in terms of our calendar year. Because if we look at the whole issue of sustainability, sustainability covers three pillars: economic, environmental and societal. But realistically, on that societal question, it's how we deal and support the most vulnerable that dictates whether we're a good society or not. And that's where really the conference today was focusing on. This morning we heard we had very personal stories from George Graham and Peter Hines in terms of how they overcame adversity and recovered. And I think that was a critical message to me, is the opportunity here for, I suppose, how we deal with challenges in all our lives. So my first key message, I think, that I'd like to give everybody and that you might take away is this whole issue around stigma. And that stigma around seeking help for mental health needs to change, and that we can all take a part in terms of talking about mental health, supporting each other, just as was described by the panel here, as if you're dealing with a broken leg or about cancer. It's totally unacceptable to use language associated with mental health as a slur against anybody, irrespective of their health. And such language is hurtful and demeaning and undermines effort to remove the stigma. On the other hand, never underestimate the power of a kind word or deed. Knowing that somebody cares or is willing to make a kind gesture could help a person to have a more positive outlook on their own self-worth, on their outlook in life. I think it was John, said, which struck me, which our response here needs not to be described as a response, but more regular in terms of how we engage. The first panel delved into the background and helped us understand the situation regarding mental well-being in the farming community. It was reassuring to hear from David Meredith that in his assessment, overall, there is no evidence of mental health crisis in the sector. But we must continue to act to ensure it does not become a crisis. The Farmers Have Heart study found that almost 3 in 4 farmers scored average or above average for well-being, with only 13% having poor well-being. The significant minority of farmers who have poor well-being must have access and receive the necessary support. A study conducted by UCD found that more farmers die through self-inflicted injury than through personal injury, and that we have to take account of. Rural communities similarly are no longer immune to the impact of substance abuse, with drug and alcohol abuse leading to poor mental health and also to increase the risk of fatal or non-fatal accidents on the farm, on the trawler or in the forest. The panel also discussed the many stressors affecting farmers, fishers and foresters, and they range from the immediate impact of workload, weather, price fluctuations, and to the longer term uncertainties such as climate change and related policies. That brings me to the second message that I took from today, which is good communication plays a key role in minimizing stressors. Good communication should ensure that every farmer can understand and assess the potential impacts of external factors on the farm. I was particularly struck at this panel in terms of saying good communication is as much about listening as it is about talking, and I think we should all reflect on that. On Firm Ground programme will continue to equip advisors and others, including department officials and vets, and that was a question that was asked in the last session, who are in regular contact with farmers, with the skills to spot the signs of a farmer who is struggling. My third point then is around the whole issue of collaboration. Collaboration is the cornerstone of the department's role in supporting other organisations working in the area of farm safety, health and well-being. And the department continues to support the work of the Health and Safety Authority, which has statutory responsibility for health and safety. The National Farm Safety Measure grant-aided quad helmets and PTO shafts, and similarly was there to support farmers in terms of overall safety on farms. The Farm Safety Partnership, for its, I'd like to recognise the Farm Safety Partnership for its commitment to improving farmer health and safety. A number of European innovation partnerships, also funded through the department, have focused on farmers' health, including their mental health. The Embrace Farm Encircle programme supports farm families who have lost a loved one or suffered serious injury in a farming accident. And we must also recognise the Be Safe programme and the new project that's starting, which is Teagasc-led Safe Habitats project with 20 partners across 12 EU member states, which has secured 4.8 million EU funding. Second panel discussion also focused on promoting and supporting farmer health and well-being, whilst we must recognise that charities play an important role in promoting mental well-being. We are marking International Men's Day, but we also have to recognise that women continue to play an important part and an unrecognised role in agriculture, something we must support. Our statement of strategy includes a strong commitment to diversity, inclusion and a fair and equal society. But there are obstacles and challenges to achieve all these goals. I'm confident by the turnout and the interest in this conference that there is a momentum to improve the mental well-being of farmers. And I think, let's be honest about it, we all discussed this morning around the first step being the hardest. And anybody who's here today or online is engaged, and we have to recognise the responsibility that's now upon us in many ways to, I suppose, expand that basis of connection and that reach out, because we have to become ambassadors in terms of the opportunity to work with people on mental well-being. Today's discussion brings home how fragile the human mind is, and hopefully events like this will give people the confidence to seek help where and when it's needed. In conclusion, I'd like to thank Minister Martin Heydon for his leadership on farm safety, health and well-being, and also thank Minister for Health, Mental Health and Older People, Mary Butler, and their department's engagement in support for this conference, but in support throughout the year. The audience in Portlaoise, I'd like to thank them, and for those that also joined the conference. Finally, just to thank the two panelists. The first panel, we had Dr. Noel Richardson, Dr. Donla O'Hagan, Dr. David Meredith, and Mr. Peter Hines. And the second panel, we had Miss Biddy O'Neill, Fergal Fox, Eddie Mullins, Josephine Rigney, John Keane, and Finola Colgan. And without their contribution, I don't think we would have, I suppose, matured and developed the conversation as best as we have today. Final thing then is just to thank my own team. You have Louise, Barry, and particular John Canny, who has dedicated his annual work programme is on farm safety, but also supported by Carmel. And then on the IT side, because remember, events like this don't happen with a lot of work from people. We have Joe Byrne and his team on the IT, which made the online session available. So I think I can add no more to the conference than this, only just to reiterate the department's support for that collaboration and engagement, and implore everybody in the room to recognise, you know, that kind word, that reach out. The gift of time is probably the most valuable gift any of us can give people within the sector in terms of that support. Okay, thank you.